Honorable guests of inductees for today. So I would like to ask our dear guests of our inductees for today to please come down and take seats behind the camera. And all inductees for day 2 as well. So inductees for today, please assemble outside and be prepared for procession. All inductees for today, kindly assemble outside in preparation for the procession. Once you assemble outside, we'll be able to arrange the sequence. And the rest of our dear guests and inductees for day 2, please take seats behind the camera. The camera is right there. Occupy any of the seats behind the camera. Thank you very much for your cooperation. And gentlemen, we will start this program shortly. But before that, please take note of the order of procession. The CEO will come first. Dr. Alassane Kanu will follow. And then we'll have the alumni of the AIPH. And then we'll have the rest of the inductees for today. Thank you. Again, this will be the order of procession. The CEO of the African Institute of Public Health Professionals, Dr. Alassane Kanu of the Institute for Health Professionals Development, will then have the alumni of the African Institute of Public Health Professionals, and then all inductees for today will follow. Thank you. Please be informed that the tassel will be on the left. Please take note of that. If your tassel is on the right, please move it to the left. Having the procession now with the CEO of the African Institute of Public Health Professionals, leading the procession. Be guided on where to sit. Please be patient with us. Thank you very much. This brings us to the end of the procession of the inductees. I will now like us to rise again, sorry about that, to invite the Honorable Minister of Health and his entourage as they process. Let us please rise up. Ladies and gentlemen, here comes the Honorable Minister of Health and his entourage. Professionals Development in Sierra Leone. Thank you very much. Please be seated. Today, we are gathered here to have a fellowship induction and inauguration of the Sierra Leone chapter of the African Institute of Public Health Professionals. You're welcome, and we have exciting events ahead of us featuring the Honorable Minister of Health, the CEO of the African Institute of Public Health Professionals, our keynote speaker, our own colleague, Dr. Aiphp Conte, and many others. Let me at this juncture invite the representative who will be giving us the Muslim prayers. And after that, we will have the Christian prayers.
Assalamu alaikum wa rahmatullahi wa barakatuh. Please join me in the Muslim prayer. Auzu billahi minash shaitani rajim. Bismillahir rahmanir rahim. I want at this moment to invoke the presence of the Almighty Allah, who is the Rahman, the most gracious, Rahim, the most merciful, and Maliki Yawmiddin, master of the day of the execution. At this fellowship induction and inauguration of the Sierra Leone chapter of the Africa Institute of Public Health Professionals, and at the same time seek refuge in his divine attribute of mercy and forgiveness. O Allah, as we commence this ceremony, make it very successful for all of us. In Atayna Kalkausar Fasalili Rabika Wanahar. Allah, we believe you have given us mankind abundance of good things on earth, such as food, water, and sunlight for free. So it is incumbent upon every one of us to continue to glorify his name and offer sacrifice. Almighty Allah, I want to believe health structures are needed as a base for health providers to provide health care for its nation. Our country, Sierra Leone today, is faced with an emerging substance abuse, and these are relatively narcotic and highly addictive drugs that needs your urgent intervention to combat this menace. Allah, let this launching of public health professionals, fellowship induction, and inauguration be a blessing for all of us. Almighty Allah, I pray for the relentless efforts of the leadership of the Ministry of Health, with the support from all the directors and program managers and the entire staff. We surely protect and have the concern about the welfare of our youth. So the CEO and team of the Institute of Public Health Professionals Sierra Leone chapter, the WHO, AU, UNICEF, and all other UN agencies and health development partners, I pray you give them more strength for their effort to make this ceremony a success. Allahumma akfir baladi Sierra Leone, anzuk jami muslimin wa muslimati fi badinati Sierra Leone. Allahumma idina sirat al-mustaqim. Allah, continue to bless Sierra Leone. Sierra Leone needs leaders who are excellent and God-fearing so that we can improve the image of Sierra Leone to be among the best in the world. Allahumma rabbana afrika laina sabra wa tabika damana wa ansuna ala qawmi kafirin. Subhana rabbika ya mu'izzata ma yasifun wa salatu wa salam ala al-mursalin. Alhamdulillah rabbil alamin. Shall we end with al-Fatiha? A'udhu billahi minash shaitani rajim. Bismillahir rahmanir rahim. Alhamdulillah rabbil alamin. Ar-Rahmanir Rahim. Maliki Yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdina siratal mustaqim. Siratal ladzina an'amta alaihim. Ghayril maghdubi alaihim waladdallin. Amen. God bless us all.
Reverend Dr. Titi Samba.
I'll be with you. Please let us stand and pray. Day that the Lord has made, let us be glad. Whom it has pleased of the occasion of today. Ask your inspiration that through the leadership structure, through the participants of this occasion, their character and integrity towards making Sierra Leone a better place. As we ask you, merciful Father, to inspire different roles to play today, we pray that as we ignite this process, you will bless the chapter. Pray for our misconceptions, and human errors. Correct us, purify us, O Father, and govern our hearts. We may attend to our calling, piety, devotion, and integrity. For this occasion, and bless us all. In the name of the Father.
Our directors of the Ministry of Health will be giving us the welcome and introduction of the chairperson. May I now kindly invite Aminata Shamit Kuruma to come forward and welcome our dear guests and attendees. Health, colleagues of the academia, development partners, fellows, inductees, members of the First Estate, and our distinguished ladies and gentlemen here this morning. Good morning, everybody. I am delighted to warmly welcome you all to this wonderful occasion, the fellowship induction and inauguration ceremony of the Sierra Leone chapter of the African Institute of Public Health Professionals. Today marks a pivotal moment for public health in Sierra Leone and Africa at large. We gather to celebrate our shared progress, unity, and unwavering commitment to strengthening public health systems, advancing impactful research, and fostering collaboration among dedicated professionals across the continent. As we formally induct our new fellows and inaugurate the Sierra Leone chapter, we stand on the brink of a new era filled with promise, purpose, and unyielding determination to enhance the health and well-being of our communities. I am also honored to introduce our chairman for this momentous occasion, Dr. Alhaji Umar Njai, a well-known name in our country and also in the region. A distinguished and prominent technical leader and scholar with expertise spanning biomedical science, environmental science, public health, anthropology, and indigenous African knowledge systems. He serves as an associate professor of medicine at the California University of Science and Health and Medicine at the University of Sierra Leone, and he is also the director of the Global Health Institute, One Health Center at the University of Wisconsin-Madison. He is the founder and chief strategist of Project 1808 in Koinadugu College in Sierra Leone, which addresses the needs of undeserving communities. He has led significant research on Ebola, contributing to vaccine development and advancing knowledge in infectious diseases. Dr. Njai is also a member of the African Research Excellence Fund and serves as the Africa CDC champion for Sierra Leone. His extensive experience includes role as a senior scientist at Procter and Gamble and co-chair of the West African Consortium for Clinical Research on Epidemic Pathogens, a prolific writer and public health commentator. He has received numerous accolades for his impactful work in global health. Given all that he has accomplished, there's so much we can say. But for now, let us all warmly welcome our chairman for this landmark event, Dr. Alhaji Umar Njai.
Minister of Health, Dr. Dembi. Health, colleagues, academia who are here from the universities, guests who are in attendance to support. I say good morning to everyone. Good morning. Good morning. I want to hear you more. Good morning. All right, this is a very happy moment. It's not like, we are here. It's a significant moment. Significant because of where we've been in the past and where we are today. And I think this is a moment where each and every one of us in this room, as Sierra Leoneans, we should at least stand up and clap for ourselves. Please, let's do this. Let's clap. And I would like to start by really thanking some of the colleagues and people who have come before in terms of the evolution of public health in Sierra Leone. Every time, each generation must confront its own realities and face it wholeheartedly in very open manner. And that's something Franz Fanon said. The generations before us, they confronted Ebola. Some people lost their lives. Some people did survive and then continued on. And even before that, we had generations that confronted the civil war in this country. And they survived and continued on, confronted Ebola, and then some people died, and then some people continued to this day. Those generations that continued laid the foundation for what we are having today in terms of beginning to put together the pieces of a public health system in Sierra Leone. That has been pushed forward through the work of our honorable minister here to set up a public health act, and then that has been translated to our national public health system, which is a fantastic, a significant achievement for Sierra Leone. So today, if we are here today, we should really, really also recognize those people who laid the foundation for building this public health system in Sierra Leone, and some of our colleagues who played vital role are not here today with us. So I'd like just for a minute of silence for some of our colleagues who have been fundamental. I know people like Dr. Clifford. I know people like my good friend and classmate, Umar Khan, died in the Ebola outbreak. So many, many others who were very pivotal. Dr. Wuri was a pivotal consultant for the Public Health Act at the beginning of everything. So let's have a minute, just a minute of silence for people who have really helped us in terms of getting to this point. And then we'll continue. Please, let's rise for a minute of silence, please. Amen. Amen. So I'm really, really humbled this morning to stand in front of luminaries here, people with extensive, vast knowledge in public health, people who have served this country in every region and every corner of this country. I have had the privilege of interacting with someone like Dr. Titi Samba, who, is just a historian, and he carries just so much knowledge of public health systems and evolution in this country. And this morning, I see a lot of colleagues here, young and old. And that's the beauty of public health, building that intergenerational knowledge system. Healthcare is vital to all of us some of the time. But public health is vital to all of us all the time. That's the distinct difference. Public health is vital to all of us all the time. And the idea that some lives matter less is the root of all that is wrong sometimes in the world. So today, many of you are going to be inducted into public health. And public health is changing. It is a dynamic field. And that's why it is a system. It is a system because it is very dynamic and it requires the multidisciplinarity of things. It requires transdisciplinarity and interdisciplinarity. So when you become a public health fellow, as we will be inducting many people today, I think it is a good thing for this country because as a country, Sierra Leone, we are endemic to a lot of infectious diseases. Some are epidemic in nature. But there is also the challenge of global mobility today, transboundary, transcontinental mobility. I could be in Singapore. Next day I am in New York. Next day I am in Sierra Leone doing business. And whatever I carry from Singapore will land in Sierra Leone within 3 days. Transcontinentality. We also are facing increasing threats from climate change. Climate change is changing the dynamics of how pathogens are activated. Climate change is changing the geographic boundaries of where we find pathogens. New variants are emerging every day of things like Lassa and other pathogens. We see Marburg expanding from its original geographic basis in Congo and other parts of West Africa and taking on more virulent form or more transmittive forms. And all of these have a bearing in some one way or the other to forms of climate change. Or whether we are dealing with extreme food events that have to deal with drought, that has to deal with flooding, issues of malnutrition, that's going to impact maternal mortality and impact child mortality. All of these are issues that we now need to address as public health professionals. And I'm glad that this room is now full of professionals in Sierra Leone that can begin to think around evidence-based, can begin to utilize research and bring that research into the clinic and expand on outcomes, increase outcomes, enable government to develop sound policies, enable sound interventions and innovative practices. So this morning, I am just here to be the chair and direct the show. So I would take a moment to invite some key individuals to the table, the high table. I will invite and recognize the registrar of the African Institute of Public Health Professionals, who is here with us all the way from Nigeria. Please, high table. And I want to also recognize and bring to the high table the CEO of the Institute for Health Professional Development in Sierra Leone, the man who is the brain behind all of this. Alassane and, Prof. Mohammed Kanu from the University of Tennessee. I also want to invite to the high table the head of WHO to Sierra Leone, and who is Dr. Musake, Robert Musake, and then the head of the UN Commission for Africa, if he's in the room. The head of professional associations, Sierra Leone, I want to recognize the Sierra Leone Medical and Dental Association, if they're in the room. They can mostly sit, yeah, you can sit, and then we can call on you to do a statement. So I think we will get started with the program with our members of the high table giving brief statements. And please be brief because, time is money, time is wealth. So I'll call on the goodwill message. I'll call on the registrar of the, all right, good morning, sorry about that. So we'll have a welcome remark by the Chief Medical Officer, Dr. Sati Kane.
Thank you very much, Professor Njai, the Honorable Minister of Health and his deputy, the Registrar of the African Institute of Public Health Professionals in Africa, of course, the CEO for the Institute of Health Professional Development in Sierra Leone, Professor Kanu, and his brother, my brother also, Dr. Kanu, colleague inductees, members of the diplomatic and consular corps, our UN partners, families, the Fourth Estate. Ladies and gentlemen, good morning. So the chairman said we should be brief, and after listening to him, I think I will just make it very sharp and then leave. It is important that we have this. If we reflect on the journey we've embarked on since the war, we now know that it is necessary to have an association like this. So I welcome you to this gathering, because you are among the elites within the public health space in your own right, and we are expecting more. After today, we expect the public health system of Sierra Leone to improve gradually and even exponentially. We've made tremendous gains in the health sector, and that is the backdrop we are coming into it. We'll reduce maternal mortality. We'll reduce infant mortality. We are now catching or noticing our outbreaks within 24 hours. We are responding to them within 24 hours. But it is still not enough. We need to do more. We now need to do things extraordinarily for us to be where we want to be. At a maternal mortality rate of 354, it is good. But if you compare to Morocco, that is within 70, we are yet far. So this body is expected to really work together. So having us as fellows of a noble institution today is not an end to itself. But we should challenge ourselves. What do we do? Many times our action and inactions have created problems. For example, I could remember during COVID response, when we started, we militarized it. When we get a case, the way we went to collect the cases to isolate them. It is a proven fact that we need to isolate those patients. But then the way we did it made all our cases to hide. And then by the time we caught them, it was far. So our actions at times, during Ebola, we are getting more infections because people were not ready to go by our ways and they were burying their parents, their loved ones. It took Focus 1000 and people to do a research. Then we overcame it. We also saw that with fever, because of the case definition, any fever, people were taken to the holding centers. And the cases were not coming down. We did a mass distribution of ACTs. And we also saw how it bent the curve. So we are in this. I brought this together to remind us that after today, we should be the ones to bring in cutting-edge strategies and ways of reinventing or redoing things that we used to do. And the latest one is the Mpox. Our action and inaction can change things. Just by social media, giving the genital manifestation. What are we now seeing? People are pushing to take the vaccines. But if we now let the people know of a particular organization or a group of people, if we are not careful, we may be stigmatizing people. So as we gather today as researchers, as academics, and service providers, we have to know that a lot is ahead of us. Climate change, as they said. Why is it that children that have been vaccinated with measles, which we know is a live something, it gives you the protection, are coming down. Some even have 2 vaccines of measles, potent, and they are still coming down with measles. We have a lot before us to do. So it is good that we are wearing all these things, but our work is cut out before you, all of us. So I now take this opportunity to welcome all of you to this gathering, but then to the work that is ahead of us to do. Thank you very much.
Thank you, Dr. Kenny. And I'd actually want you to come to the podium to sit up on the panel, so please take one of the seats up there. All right. So, Dr. Kenny has mentioned, and he's actually put it to all of us here, the work is cut out for us. It's not just about being inducted today and taking nice pictures, but it's about action. Our action and inaction can lead to different dynamics. And he has actually really highlighted, currently we face an Mpox outbreak where all of us, our action is needed to kind of contain that outbreak. So without taking much, may I call on Dr. Aissata Nani Conte. So I will now call on the registrar from the African Institute of Public Health Professionals to give us an overview of the African Institute of Public Health Professionals. Sir, you are very much welcome and to Sierra Leone.
The Honorable Minister, Chairman, Organizing Committee, the founder, Institute for Health Professional Development, Sierra Leone. Members of Diplomatic Corps, distinguished members of African Institute of Public Health Professional, respected members of the media, present, ladies and gentlemen. It is my singular honor and pleasure to welcome you to this august occasion of this fellowship induction of African Institute of Public Health Professional and inauguration of Sierra Leone chapter. Ladies and gentlemen, permit me to remind you that during the 6th Annual International Public Health Conference in Accra, November last year, a decision was reached to hold this occasion in Freetown. Application was sent to the leadership of African Institute of Public Health Professional by Dr. Alhassan Kanu Fuad, the founder and CEO of Institute for Health Professional Development, Sierra Leone, for us to hold this program here in Sierra Leone. Considering the unique status of Sierra Leone as a hub of intellectual erudition and exchange in West Africa, and indeed Africa, coupled with a rich history of freedom of thoughts, accommodation of diverse opinion, and tolerance of critical thinking that led to the growth and development of mankind, arguably, there is no better place to have this program at this time. Sierra Leone, without mincing words, may I declare that Sierra Leone supply us with all forms of mental and physical inspiration needs to power African Institute of Public Health Professional. Distinguished inductees and participants, permit me to pay homage to Dr. Alhassan Kanu Fuad, a worthy son of Africa, a man of words and candor. Fortuitously, Dr. Kanu was one of the keynote speakers at the 6th Annual International Public Health Conference in Accra, Ghana, November last year. His presentation, Sierra Leone is on the right path in attaining universal health coverage by the year 2030. Also, permit me to extend our sincere appreciation to you all for your resilience exhibited to be registered as member of African Institute of Public Health Professionals. In spite of global economic downturn
currently experienced all over the world. This is a rare commitment to professionalism in health, to professionalism as health professional. For your tenacity, I hereby doff my cap. Distinguished participants and inductees, may I say with utmost tone of sincerity, I am confident that you are going to make crucial contribution to the progress of the attainment of universal health coverage in Sierra Leone and indeed larger Africa. In this way, you are going to serve the larger interests of public health practice on the lives and soul of the Sierra Leone populace. On this note, without any fear of letdown, rely on our commitment in Africa Institute of Public Health Professional. The African Institute of Public Health Professional vision of reducing diseases in Africa is bold, apt, and attainable. It is entwined in Sustainable Development Goal 3, ensure healthy lives and promote well-being for all at all ages. Aiphp is focused in investing in health workforce, particularly public health professionals in Africa. The theme of this fellowship induction is building a resilient health system for universal health coverage and health security in Sierra Leone. We are proud to announce our distinguished fellows, scholars, and speakers who will speak on different aspects of this theme. Our speakers include Dr. Isata Nani Conte, a team lead for Emergency Management Support Unit, WHO. Professor Francis Chisaka Kosolo, the Director and Head of WHO Office in African Union and United Nations Economic Commission for Africa. Distinguished participants, be rest assured you are here for a real deal of professional and intellectual feats. Let me at this juncture felicitate with all newly admitted fellows, members, and associates of the Institute. On behalf of the Governing Council, I sincerely welcome you on board as your hosts of service states. You are called to serve your country and indeed African continent in advocating and promoting the laudable ideas of population-based service to prevent diseases and untoward health status and achieve healthy and productive living. Finally, Aiphp is happy to announce the implementation of series of capacity building program on leadership and management for healthcare professionals across Africa. We are privileged to collaborate with frontline international organizations such as World Health Organization, Pathfinder International Health Consultancy, Institute for Professional Development, Sierra Leone. On this note, we look forward to having mutual collaboration with other collaborators and sponsor on this project. As we all are aware that resilient health system and health security cannot be achieved in our continent without capacity building. Africa Institute of Public Health Professional is indeed committed to assist in achieving all the goals earmarked for the betterment of Africa and human race. Thank you, and God bless you all.
Thank you very much, Dr. Bankole from Nigeria. I think he mentioned some very critical points, that capacity or building capability as well as capacity is critical for a resilient health system. And what we have here is a good number of people who are joining the public health, who are sort of going to strengthen the public health profession in Sierra Leone. I think the issue of public health lies at the centrality of all human needs. The first need is having a safe environment. Having an environment where people can have good livelihood is a good human need. Access to good public health is a significant human need. And having a sound educational opportunity is a good human need. So those four needs are critical to every human being. And so public health sits in those four realms of basic human needs. So I think without much ado, I would also call on, from the Institute for Health Professional Development, a goodwill message from Professor.
This is not a solemn occasion. This is supposed to be a moment when all of you must shine. The accolades that I think you don't always get. Before I go any further, and I know I've been advised about time management, I stand here to you, or in front of you first as a proud Sierra Leonean, but also as a member, founding member of the Institute for Health Professionals Development. But before I get there, this is really very serious. And when I talk about seeing and gauging the energy in the room, I mean that. Let's look at the minister. He came, he sat there, focused as ever, and he has his lieutenant next to him, the chief medical officer. They are here to grace this occasion, and they are attentive. I see that. And I think that is good leadership, so we have to mimic that. I wish we had a room that is more filled than this. But remember that you guys are being seen around this country and around the world because of what you do. You save this country using weapons that don't always get triggered by a trigger, if you understand what I mean. You use weapons like your intellect to make up for resources that you don't always have. Some of you, even when you work and actually retire, there's not much to be proud of when you talk about material possession. My colleague here already talked about people we've lost. Dr. Victor Willoughby, Dr. Khan, and several other people. Dr. Salia, not even to talk about the number of nurses whose names we don't even know and will never know. I came in 2014 to work with the ministry. And it was then that I crossed paths with a few people here, Dr. Kene, Dr. Saskagbo, Dr. Tom Sise, and a few others. One of the stories that I still remember is that told by Dr. Saskagbo. And this was about cholera outbreak. And we are all wondering what should we do about this. Just like the chief medical officer also mentioned, now we are again on the vanguard of dealing with the Mpox. But Dr. Kagbo's story was about having all the field running from the hills downtown and sort of unsanitizing, if you will, our sources of supply. And as soon as our public health professionals thought about this and said, that's where the problem is, and the issue was resolved. This is what you guys do. And so for a moment like this, when we really want to highlight what you do, I hope you feel very proud. And I implore, thank goodness that our minister is here, the chief medical officer, who has given us a lot of support, and I'll get to that in a minute. If this organization is where it is right now, he's definitely one of the pillars behind the scenes. I'm here to talk to you about the Institute of Health Professionals Development and how it came about, and I'll be brief. Dr. Al-Hassan Kanu, who was already mentioned, thought about this. He had an idea, and he said we should establish a center for public health improvement. I'm just going very quickly. And we started that. We've conducted some activities. Okay, we've conducted, how about if I just hold this? Thank you. And we've conducted some activities already. We conducted a training workshop some time ago. We've been funded by the Bill Gates Foundation. We conducted a study on maternal child health issues, specifically focusing on uptake of family planning initiatives. We are doing what we can. But as if he was not satisfied, he said, we need also to add another component to this. And that is the birth of the Institute for Health Professionals Development. There are many other people, and I'll take a minute to name those. Sometimes it's good to be grateful. And he said we should help train our health professionals, focusing more so on short courses. Sometimes people want to retool. You know, you got the MD, the MPH, whatever the degree is. The world is evolving. Health problems are emerging. So every now and then you need to refresh at minimum. And he said we have to find ways of doing this. We know that we have immense amount of talent in our country. Some of you are retired, but the brains are still active. And you already have a lot of knowledge that we can tap from. And so the idea is we will use the local knowledge, but if we need to tap from resources out of our continent, forget the country, yes, we will. And that's what we are doing. And so today, as I speak to you, we are working in collaboration with other organizations. The Institute of African Public Health, the AIPH, I'm sorry, is already one of them. And the chair already spoke to you about the relationship between them and us and how that was established through Dr. Kanu, who is the bridge. But we are also working with the Innovative Knowledge Institute, which is housed at the Graduate School of the University of Paris, or Paris, as some people would like to call it. We have the B-Skill Global. This is based in India. They've already conducted a training for us on supply chain management. We are using some of their platforms to help train our own people, especially those at the middle level. We also have stakeholders in Kenya who are also working with us. We can't do this work. We could not have done it without your support. And that's where I really need to mention a few people here. Anytime we've had a reason to organize anything and seek the support of our health professionals, we've gone to the chief medical officer. And sometimes if he needs to be there physically, he had done so. At times, he uses his office to introduce us, to ask for participation from his people in the ministry. And they've graced our occasion. But there are other people who've worked behind the scene to do this. Dr. Saskago was there from the very inception of all of this. You actually never see him at the forefront. Dr. Frances Fona, Mr. Clifford Kamara, Mr. Philip Amara, who is not here, I know he's in Michigan, Mr. Michael Gosoa, Dr. Safar Smart, Mr. Joseph Senesi, Mr. James Masakwe, Mr. Mohammed Albert Tarawali, Mr. Sir Pesima, Mr. Rena, and many other people. The list is long. These are people who have put shoulders to the wheel to make sure that this works. We remain very dedicated to this effort. We want to continue to not only impart knowledge, but to showcase the work that the ministry is doing. So we implore our minister and his senior officials, Sierra Leone needs to showcase you people more than we are currently doing. And I think the Sierra Leone Medical Dental Association can collaborate with our institute. Now that we are also going to have a chapter of the continental organization, we should do this. We should tell your story, and you should be proud that your story is told in the way and manner that it should be. So with those, I just want to pledge our support, Mr. Minister, Mr. CMO. We are here to serve. We are here to work with you. We will take directives from you. We will take the initiatives. We want collaboration because in the end, this is about our country. We want to make sure that we continue to save lives. And I congratulate all those who are going to be inducted today. I was lucky to have been inducted last year, but I am with you, and we are immensely proud of you, and congratulations. Thank you very much.
Thank you very much, Prof. Kanu. Whenever the professor speaks, you learn a lot. So I think I'll join him again in congratulating everyone who is going to be inducted today. I was very happy walking in this morning to see some who I taught public health and others who have worked with. And this room is filled with brains and technical power, very strong. This is probably one of the best. If I have to go into any public health battle, I need this room. Everyone in this room to be with me. I think people in this room have, it's like when COVID hit, it came to Africa. And I had one of my friends making an analogy between a soldier who is being in combat as against somebody who was not in combat. And he said in Africa, one of the things that made us successful with COVID was that we've been in combat. We've been in action, doing it all the time. And so we were ready. And I think this room is ready. And I think one of the things that Dr. Kanu touched on is how we can take this to a higher level. And that means sometimes as professionals, which you are all doing now, is to learn, right? We are learning. We've learned the public health. But sometimes it requires us to unlearn everything you've learned before, and then relearn. So if you ever have to go back today, think about learning, unlearning, and relearning. This is critical for you to be very successful in public health. May I ask everyone who's come, who is seated way at the back, please come to the front. Please come. There is a lot of room. Please come. We want you all. It's not COVID time. There is no social distancing at this time. So come and to the front. You are here, some of you, to support your families. So please move down a little bit so we can, people don't have to yell across the room. So I'm happy again, and I really need to thank Dr. Alassane Kanu and Professor Mohamed Kanu with the Institute for Health Professional Development, because this is important for us in Sierra Leone. We need to begin to start competing. We have a lot of brains in this country. We have a lot of talent. We've done a lot of work. We sit on a lot of data. That data needs to be translated into information. And I was very happy that Dr. Kaba is in this room, who is actually an elder brother to me. My elder brother is named after his uncle. So, just think of it. We are in Kwenadugo, they're in all the way out in the south. So I talked to him about setting up a research team in every clinic, in every hospital. We need a research unit. And with this crop of professionals we are now getting, this is how we move the healthcare system. You move things by doing that research in those clinics, those facilities, seeing something that is coming, seeing patterns that are different, seeing something that doesn't look all right, seeing one case, seeing a case series, seeing stuff. So you begin to kind of walk, and we have to tell our stories, just like Professor Kanu said. We must tell our stories. We must translate the data to information and then publish these things so that somebody else is not coming and taking that data and publishing it. The data is gold. So we have to lead, and as this team, I think it's a very good platform that the Institute for Health Professionals is creating for us. So without much ado, I think there is a lot of groups here that can speak to this. All the bodies that have been asked to speak towards this idea of creating health excellence in research. So I will now call on the representative from the Sierra Leone Medical and Dental Association to give us a brief remark, right?
Good morning. Mr. Chairman, Professor Njai, who happens to be a mentor to me, our result-oriented Honorable Minister of Health, Dr. Austin Dembe. If I may, I want to take a moment to acknowledge the existing protocols with great respect. On behalf of our President, Dr. Freddie Coker, who unfortunately cannot be here today due to other commitments, and the entire membership of the Sierra Leone Medical and Dental Association, I extend our warmest greetings and heartfelt congratulations on this momentous occasion, the induction of new fellows into the African Institute of Public Health Professionals and the inauguration of the Sierra Leone chapter. Today is a celebration of leadership, vision, and commitment, as highlighted by the CEO of the Aiphp. It's about people who have chosen to lead from the front in achieving the theme of this occasion, to make our health systems stronger and our nation healthier. SLMD is excited to see many medical doctors here who will be inducted as fellows of the Aiphp, and Sierra Leone confidently step into the continental arena. And the good news is this: we will and proud to work alongside you, championing transformative changes for a more resilient health system. To us, the new fellows, our journey is just beginning, and we are inspired by what lies ahead. Congratulations once again, and may Allah bless us all. I am Dr. Abdul Jallo, the Scientific Secretary of the SLMDA. Juma Mubarak.
Thank you very much, Dr. Jallo. So in the interest of time, we have to go down to 2 minutes each. So I will now call on the representative from the Nursing and Midwifery Council, or Midwifery Council.
Thank you very much, Mr. Chairman. Mr. Chairman, members on the high table, our distinguished invitees, colleagues to be inducted soon. Good morning. Good morning.
Good morning.
I bring you greetings from the Sierra Leone Nursing and Midwifery Council, and it is an honor and privilege for me to stand in front of you to give a goodwill message on this August meeting. So on behalf of the Sierra Leone Nursing and Midwifery Council, I extend our warmest congratulations to all of us who are going to be inducted soon. This is what we've been waiting for. This is what we've been dreaming for. And today, it's become a reality. So said the council members. Our commitment to advancing the health and well-being to our communities is truly commendable. As we are about to join the esteemed ranks of fellows, the Nursing and Midwifery Council Sierra Leone recognizes the wealth of knowledge, expertise, and leadership we will bring together in accordance to our new rules. You will all agree with me that nurses and midwives, as frontline health providers, work hand in hand with team members in disease surveillance, health education, community health initiatives, and these people are strong pillars in whatever community or public health we undertake. We are confident our collective efforts will be instrumental in shaping a healthier Sierra Leone, and not only Sierra Leone, but Africa. We are again aware of the ever-evolving challenges in public health, and we all know that challenges are meant to be met. So the council members are seated, and they asked me to inform the Institute of Public Health Professionals that they are more than willing to contribute in their own way to the growth and development of this newborn baby. So we are there ready for you, so that in whatever way you think that the council members of the Nursing and Midwifery Council can come on board, we are more than ready. We wish all of us a successful induction ceremony and a future filled with impactful achievements in our pursuit of public health excellence. May our journey as fellows be marked by continued growth, collaboration, and the realization of healthier Africa, and to an extent in Sierra Leone for all. I thank all of you.
Thank you very much. It's great to see all the nurses and midwives, and I think this is wonderful to see all the sectors, all the arms involved in building this strong public health system in Sierra Leone. And so now I'll call on the Allied Health Professional Council representative to just give us a brief, just very brief 2-minute statement.
Good morning, colleagues.
Mr. Chairman, our Honorable Minister of Health, all members of the high table, colleague inductees, and our families that are here today to grace this occasion with us, I want to say good morning to you and welcome. I want to really say, if anybody is here that is most exciting and most happy, I think I should be number one. And I have very good justification for that. Yes, I'm very happy to be here today talking to this honorable group of people. I am CHO Abu Conte, number one, 1983-84 academic year, and I'm still alive. I want to say thanks to Almighty Allah for that. Just because time does not permit me, I would love you to give you a brief story why CHO, why that name, Community Health even in Sierra Leone. Very short, please. There was a story that 3 Sierra Leoneans were fishing along River Sewa, even before the Alma Mater declaration. But they were downriver, while the river had a curve through which, under which they were fishing. For just a short time after starting fishing, they saw 3 people who had drowned upriver going down the river. They were so much worried and curious. All the same, they were able to get into the river and remove the 3 people offshore, resuscitate, and help them to survive. After some more minutes, they saw another large group, more than 5 now, shouting for their survival. Downriver, they have drowned, they are going down. They could manage, but only a few to capture a few. The rest went down the river. After some time now, a large number of group of people still were shouting, yelling from the upriver, coming down the river, please help. Let me go backward. And so the 3 people were so much disturbed, discouraged, disappointed. What are we doing? What can we do? These people now, we cannot cope. One of them asked, can I go back to the town and ask more people to come and work with us? The other one said, no, we must stay here. Whoever comes, we can manage, no matter what. The other one said, but if we can go upriver to see why these people are drowning? I think we all have the answer. Who is the best person among the suggestions? Sierra Leone inherited clinical medicine, doctors and nurses. Up to the point of appointing, creating the CHO community health family in Sierra Leone, we only have dispensers, doctors, and nurses. But we are they able really to cope with the menace in terms of healthcare? No. So the EU and members of the Sierra Leone Ministry of Health decided to create another cadre of health professionals who are not only trained in clinical, but in terms of preventive, curative, and promotive healthcare. And by then, Sierra Leone, then Minister of Health, was Dr. Belmont Williams, who in fact was a signatory to the Bamako Initiative in 1978. So that is why CHOs are here today, and inshallah, we shall continue to be here. So I'm number 1, set 1, 1983-84 academic year. Number 2, the person for whom has done whatever we are doing today is from my own class, the little ABC I taught him about principles and methods of epidemiology, health statistics, demography, in the person of Professor Fuad Kanu, is the key person, creator of what we are here today. That's another very good reason. I think I'm really happy. Number 3, but the last, I have been giving again another task by our Honorable Minister here to serve as the first chairman of Allied Health Profession Council in Sierra Leone. Can you imagine? The largest group of health professionals health workers. This includes the very public health here today we are talking about, to give them license to practice in Sierra Leone, which has never existed. Are we together? So these are some of my, and we have up to 16 or more other cadres. That's why we call it a council, who, inshallah, in the next 1 or 2 months, want to have our symbolic issue of license through the support of our able Minister of Health. So I want to, first of all, before going through the goodwill, to share this information with you. Thank you for listening to me. Yes, you have to. So this is my goodwill message, please, ladies and gentlemen. A goodwill message to all of us, distinguished colleagues, honored guests, esteemed health professionals. It is with great pride and heartfelt congratulations that I extend warm greetings on behalf of the Allied Health Professional Council, Sierra Leone, as we join hands to witness a historic moment. The inauguration of the Sierra Leone chapter of the Institute of Public Health Professional Development and the hosting of the prestigious African Institute of Public Health Fellowship. This milestone is not only a testament to the growing recognition of Sierra Leone's role in advancing public health across the continent, but also a celebration of power of partnership, learning, and professional growth. The Allied Health Profession Council stands in full support of this noble initiative. We believe that a strong, skilled, and united health workforce is the cornerstone of sustainable health system. The establishment of the chapter will open doors for collaboration, continuing education, and innovation in service delivery. It offers a variety platform for other health professionals to contribute meaningfully to the research, policy, and practice, locally and globally. As we welcome this new chapter, let us be reminded that excellence in public health requires not just knowledge, but leadership, compassion, and vision. Together, let us nurture a new generation of professionals committed to equity, resilience, and transformation of healthcare. Congratulations once again to the Institute of Health Professional Development and to the Fellow of the African Institute of Public Health Professionals. May this journey be marked by purpose, partnership, and progress for a healthcare Sierra Leone and Africa at large. I want to thank you all.
Well done. Thank you, sir.
Thank you.
Thank you very much, CHO Abu Conte. Your service is well appreciated and respected, and I have learned a lot from you in the interactions I've had with you. The wealth of knowledge you have is tremendous. So I would now call on a representative from our leading partner in country, WHO, to give a brief statement. I know he will be very brief. He will be, so Dr. Robert.
Thank you so much, Chair. I don't know why you're against me this morning, but I'll try my best. My only 2 minutes will be more brief than those of my predecessor. Thank you once again, Honorable Minister, members of the High Table, distinguished guests, ladies and gentlemen. I want to take this opportunity to greet you and to bring you regards from the country representative of WHO, who is unavoidably absent, so I'm really feeling his big shoes this morning. That said, I would like to take this opportunity and pleasure to join you today as you inaugurate the Sierra Leone chapter of the African Institute of Public Health Professionals and induction of the new members and fellows. And I'm particularly glad this morning because when I look around the room, I see my own workmates at WHO among the inductees, And I also saw a lot of familiar faces, seasoned professionals that I have worked alongside in different capacities and different areas of the country over the last 10 years. So when I see you being honored this morning, I feel glad, and I'm truly glad, and this is from the bottom of my heart. WHO applauds the vision of the African Institute of Public Health Professionals to unite health professionals across diverse disciplines, to bring them together, to reduce the burden of disease on the continent, and this aligns strongly with WHO's core mandate, which is to promote health, to keep the world safe, and also to serve the vulnerable. Just to point out a few things where we stand at the moment, there are a lot of challenges going on, but I would probably point out just two. The continent is going through what we call an epidemiological transition, where we are dealing with a dual burden of infectious diseases and outbreaks. Some of them, you have already mentioned them here, which we have experienced in Sierra Leone, but there is also an upsurge of non-communicable diseases. And the task is on our shoulders to make sure that we save the continent from this dual burden moving forward. And this can only be done with collaboration and unity. On the global scale also, there are a lot of changes that are ongoing. We saw the COVID pandemic and how it affected everyone, but there is also challenges with health diplomacy going on at the moment. And again, we need to be aware to some of these realities. Just looking forward in a few weeks' time, our Honorable Minister and other distinguished members from Sierra Leone will be representing us at the global level in Geneva when the World Health Assembly takes place. And this is of particular interest to us because in that sitting of the World Health Assembly, we shall get a new regional director for Africa for WHO. So this is really big business for us, and we wish them well as they represent us in Geneva. The achievement of universal health coverage can only be achieved through having a strong, well-trained and interconnected public health workforce, and the launch of this chapter today is a timely and strategic investment in this endeavor. We are moving in the right direction. And as you get inducted, I want to encourage you to keep up the spirit of professional excellency, lifelong learning, and continental solidarity, which has already been expressed this morning, but I only encourage you to continue doing the same. And I also encourage you to use this platform for innovation, mentorship, collaboration with the academia, communities, government, and partners. And thank you for choosing to invite WHO to this platform this morning. That is confirmation of the same. On behalf of WHO, I would like to extend heartfelt congratulations to the leadership and members of the African Institute of Public Health Professionals, and to reaffirm that WHO will remain available to support all your efforts moving forward as we contribute together to a healthier, stronger, and more resilient Sierra Leone. Thank you very much, and I wish you success in your noble endeavors.
Thank you very much. So now we'll hear from the head of WHO to the AU and the UN Commission for Africa, Professor Francis Kasolo, if he is in the room.
Thank you very much, Mr. Chairman, Honorable Minister, Dr. Austin Dembe, Deputy Minister, Health 1, Chief Medical Officer. Should I just say I stand on already established protocol? It is an honor to participate in this momentous gathering, the induction of new fellows and the inauguration of the Sierra Leone chapter of the Africa Institute of Public Health Professionals. I would like to commend the men and women that have made this launch possible. This gathering signifies
not only the commitment of each one of you present to advance the field of public health, but also our collective resolve to uplift the health and well-being of communities across Sierra Leone and indeed Africa. In our ever-changing world, public health remains a critical pillar of human development and existence. Mr. Distinguished ladies and gentlemen, the challenges we face on our continent and indeed in Sierra Leone, be it the threat of communicable diseases, the impact led to attainment of universal health coverage. In launching the Sierra Leone chapter, let us envisage a future where our healthcare professionals are not only well-trained, but are also leaders in their field. A future of where healthcare professionals contribute to research that shapes public health policy, advocate for the vulnerable, and inspire the next generation of health workers. As I conclude, let us collectively reaffirm our commitment to the principles that bind us in public health as public health experts. That is equity, access, integrity, and excellence. Together, we will rise above the challenges we face in the realm of public health, forging a path toward a healthier and more resilient Sierra Leone and Africa. A healthier and more resilient Sierra Leone and Africa. May God bless the Africa Institute of Public Health Professionals and Sierra Leone, and I thank you.
Thank you very much, Professor Francis, for that brilliant statement. And he mentioned some significant point that everyone here should bear in mind, something that should really help the minister and help the ministry in terms of health, and think that health for all is not possible. It's something we have to work to. Health for all is not possible. It's something we have to work towards, building that equity. But before I get to that, I know our Honorable Minister of Health has been very patient, but he is a professional and somebody who loves research, somebody who loves public health. That's why he is here. He's been sitting and very, very, very excited for this type of things. So I think we would like to recognize partners and guests from FCDO, the representative, and then Cyrus Demby, support the Honorable Minister of Health. Please clap for them. The Deputy Minister, one, Dr. Senesi. The Deputy Chief Medical Officer, Dr. Mustafa Kaba. Dr. Saskago. The Chief Nursing and Midwifery Officer, Matron Mary Fuller. President of the Sierra Leone Postgraduate College of Nursing and Midwifery, and all directors of the Ministry of Health in the room. And everyone else who's come here, relatives, friends, family members, everyone. Please give yourself a hand. So I will now take this opportunity, and I'd like you all to stand up, because you've been sitting for a while. So please stand up. And I want to take this opportunity to invite our distinguished guest, a distinguished leader, someone who has excelled both locally and internationally. I started reading papers, a lot of stuff. Dr. Demby isn't aware, but I read some of his papers from work from LASA, but also on an outbreak of or a spillover of a pesticide in Kenema back then that led to some deaths. But someone who's actually been involved in a lot of work, not just in Sierra Leone, but across the world and in the US, of course, and someone who is passionate about both laboratory medicine, public health, and research. So, without much ado, I'd like to invite our Honorable Minister of Health, Dr. Austin Demby, for the official launching of the Sierra Leone chapter.
Please be seated. Thank you very much, Mr. Chair. Good morning. Good morning. I think it's a lively occasion. I really want that reflected in all of us being here today. Good morning. Good morning. Great, fantastic. I think I would like to borrow a chapter from Mr. Conte, and I have some prepared remarks, and I'll beg your indulgence to just give me a few minutes to provide some context to it. Mr. Conte was 001 in 1983. I think he deserves a big round of applause. Great job for being there. I also just want to remind everybody here that my initial academic degree was in 1980. But something very interesting I want to reflect on, because I have had a bachelor's degree and a master's degree and a doctoral degree, and I consistently refused to be robed. And I refused to be robed because I thought robing was kind of terminal. Shows that you've arrived, you've reached there. And I always felt that I haven't reached there yet. I'm working on it. So today is a major exception. I realize that I have arrived. So thank you very much for the institute. Again, leaning on Mr. Conte's comments about people floating down the Sewa River. And you could stand downstream of the Sewa River and pick people out of the water and do all kinds of manipulation to have them recover. And people will sing praises of you. They will clap for you because you're the local hero. Some might even be rushed to the hospital. You could have major clinical interventions around these people, and people will applaud you. They may have broken an arm or something, and you go ahead and fix the arm. They may have nicked the Achilles tendon, and you have a surgeon who will come and fix it, and get a round of applause. But listen to what Mr. Conte was saying. Standing downstream and fixing all of these people who are coming down is a great accolade, and I think that's what clinical medicine is all about. But going upstream to find out, why are these people falling in the water and coming downstream anyway? Is there something we could do upstream that could stop this from happening? Stop people from falling into the water, stop people from drowning, stop people from going downstream. Not one person, but the whole community, the whole public. That is public health. You could be the top surgeon, top brain surgeon, that comes in, somebody has a stroke, they're going to die. They rush them in. You go in and you open the brain and you remove the blood clot, and the Glasgow index goes from 3 to 15. And everybody gives you a round of applause. Ask the Savior. That is clinical medicine. That is really great. But you know what? For you to get that stroke, there are lots of things that were going on that if you'd corrected it, you probably wouldn't get a stroke. If you'd managed your salt intake, if you had modest exercise, if you figured that you shouldn't be eating rice at 10 o'clock at night, yeah, if you looked at your diet and lifestyle changes, you probably wouldn't need that intervention. Being able to work with the whole public and help them with these critical things is public health. It is the public. Your patient is the general public. But guess what? The surgeon who removes this brain clot in there gets the big round of applause. The healthcare worker who goes and helps people to prevent it in the first place, identify it early, make sure that this intervention takes place. The public health worker who is looking at the whole public, do they get that level of recognition? No. But you know what? The surgeon who removes this gets a lot of pride. The healthcare worker, the public health worker, does not require a thank you or an accolade. The joy and pride of what you do is inside. There is strength in numbers. You could do that alone in Makeni or in Mabroka, in Mashaka, in Jerion. You could be doing that easily, and nobody knows. But we know. We know who the healthcare workers are, the public health workers are. But when you get an organization like this that comes together and say we have an institution that has a common focus, common values, recognizes what we do, that is a positive step in the right direction. That's why today, I'm nearly as happy as Mr. Conte, if not happier. But the last couple of years have been really exciting because none of this is rocket science. It's been going on since Mr. Conte's days and even before Mr. Conte's days. We didn't have a name for it then, but now we do. But in the last few years, it's all been coming together. We saw what we did for Ebola. We saw how that helped us with COVID. We saw how that is helping us with the Mpox outbreak that we're dealing with right now. For you to get the level of recognition for what you do, you require legal legislative coverage. That's why the public health law was passed a few years ago. So thank you very much to everybody that worked into making sure that Parliament actually passed the law. The Allied Health Organization, which is a conglomeration of multiple practitioners, they also needed legal coverage. And that law was also passed by Parliament. That's why we have Mr. Conte now as the chair of the Allied Health Professionals Group. At the same time, you could practice here, you could practice there, you could practice in the hospital, you could practice in the community, but you want an institutional home. That is why we created the National Public Health Agency, NPHA. I think we need a big round of applause for that. And so to crown it all now, you don't only have the laws, you don't only have the organizations, you don't only have the institutions, but you have a professional body that's been put together. So again, we're putting public health squarely on the map as complementary to clinical services, because for us, you need both of these arms of healthcare delivery for us to achieve universal health coverage. So I'm a happy person, and I want that happiness to be reflected in you all as well. And let us move forward with the launch of this important institution. And I'll borrow again from Mr. Conte and ask your indulgence to go to my prepared remarks. Distinguished fellows, members of the African Institute of Public Health Professionals, esteemed guests and dignitaries, friends and colleagues in the health sector, ladies and gentlemen, and I want to take special permission from the chair to acknowledge the registrar, to acknowledge Dr. Kanu, and to have a special welcome to my friend, Frank Asola, for coming all the way to be here with us. It is with great pleasure and profound sense of responsibility that I stand before you today on this momentous occasion as we establish a chapter of the African Institute of Public Health Professionals, AIPHP, here in Sierra Leone. This initiative marks a significant milestone not only for our nation, but also for our collective commitment to improving public health across the African continent. I want to take this opportunity to first welcome and thank the senior colleagues of AIPHP who have traveled from our sister country of Nigeria and from other places to honor this occasion with their presence. Your leadership and dedication in founding this institute will be remembered for generations. Let me extend warm appreciation to our colleagues from Nigeria and other countries who have joined us today. Your presence underscores the spirit of Pan-African solidarity that this institute embodies. I also wish to commend Dr. Alhassan Fouad Kanu and the Institute of Health Professionals Development for the tireless efforts in organizing this remarkable event. Today's event reflects not only a celebration of personal achievements for our new inductees, but also a bold step forward in our nation's public health journey. The formation of this chapter is a testament to our collective commitment to strengthening health systems through professionalism, peer learning, and evidence-driven collaboration. The titles of associate member, full member, and fellow are not merely honors, they're calls to leadership and service. You, our distinguished inductees, represent the future of public health in Sierra Leone and the region. Through your expertise and resolve, you will help address persistent challenges from infectious disease outbreaks to maternal mortality, from data gaps to health workforce shortages. The African Institute of Public Health Professionals is more than a professional body. It is a movement, a platform where dialogue meets action, where policy meets evidence, and where mentorship meets innovation. By establishing a national chapter, we're creating a sustainable mechanism to promote continuous professional development, ethical practice, and impactful public health leadership. At the Ministry of Health, we believe that public health is the backbone of national progress. Our shared future depends on how well we can prevent diseases, promote health equity, and prepare resilient systems that serve every citizen. In this regard, professionals like you cannot be overstated. You are the engine behind the transformation we seek. Let me also recognize the critical role of partnerships, whether from development partners, academic institutions, or the private sector. Our achievements in public health have made possible through collaboration. We thank all partners who have stood with Sierra Leone in building a healthier, stronger, and more equitable health system. To all the new members and fellow inductees today, I offer my heartfelt congratulations. Your journey of impact is just beginning. Carry this honor with humility and determination. Be agents of change. Be mentors. Be advocates for excellence in public health. Together, let us use this platform to elevate standards, empower communities, and deliver on the promise of health for all Sierra Leoneans. I thank you. I look forward to the great work of this new chapter will accomplish in the years to come. And on that note, it is a great honor and privilege today, Friday, the 25th of April, to officially launch the African Institute of Public Health Professionals, AIPHP, and Fellowship Induction and Inauguration of the Sierra Leone chapter. Congratulations. Thank you very much. Fortunately, my brother is here visiting from the States. They wonder what I do every day. Uncle Malo, this is what I do every day. Welcome. Thank you very much. Thank you.
Thank you very much. Thank you very much. So we are now officially launched. Thank you, Mr. Minister. And our Honorable Minister touched on some key points, and one of the quotes I will say is, "You are the engine behind the transformation we seek." So that's something to bear in mind, and your journey of impact is just beginning. So I think many of you will be going out to do significant things in developing Sierra Leone. So now I will turn on to the inauguration of the Sierra Leone chapter by the AIPHP and the acceptance speech by the chairman of the chapter. All right. Thank you.
Thank you very much. I am so happy when the Honorable Minister accepted to be part of us. Meaning we are having 3 ministers of health in Africa. The last was in Egypt, in person of Professor Dr. Hawa Wagida. The first was in Nigeria. We are happy to have you in our fold, sir. Thank you very much, sir. Honorable Minister, sir, we'll be pleased if you can help us decorate the chairman of Sierra Leone chapter. He has to be decorated specially. Thank you very much, sir. I also call Professor Castallo to come, Professor Keynote to come, Dr. Conte, please.
All right, colleagues, thank you very much. I stand here very humble to give an acceptance speech, but I want to have you reflect this question. If you are let's assume you take the role of your parent, mother or father, their jobs, their titles. Who are you today? If you were to take your father's or your mother's role, who are you today? I'll come back for you to give me a response to that. Honorable Minister, Mr. Chairman, colleague professionals, I hereby accept this very honorable task to lead this chapter in Sierra Leone. And I want to say, we are having the first chapter of the African Institute in Africa. A pride for us as Sierra Leoneans. And if I'm to accept this, is about what is the vision going forward. The vision here, Honorable Minister, African Institute is a regional body. Now we are going to have it localized. Today, we talk of the public health society, the Lawyer Society. As we do this place later today or tomorrow, let's reflect how can we localize this to ensure we reach out to what the minister is calling for and other speakers. We are going to establish a public health society that will bring us together. Look how unique. There is no network body like this that brings in every professional in the room. EHOs, CHOs, nurses, pharmacists, doctors, you name it. It's enviable. So what do? to better the lives of our people. What do we do to ensure we kind of achieve the desired goal of the ministry alongside our partners? With that, colleagues, I want to entreat other established networking body here in Sierra Leone. We have the postgraduate school of with several roles, be it the nurses and the like. We have the public health now, a very big body. How can we bring them in that fold? How can we collaborate with other regional bodies? My vision here, we are going to take AIPH beyond the Anglophone country. Mr. CEO, I will use my intermediate French to take AIPH to Guinea, to Senegal, to Ivory Coast, to Togo, you name it. And my colleagues in Guinea, and mes collègues du Guinée, du Côte d'Ivoire, du Sénégal, nous venons. We are coming. Honorable Minister, when we launched this application, we are hoping to have like 100. Just the one will get over 150 applicants. We end up getting 265 in total. Then AIPH says, come on, man, we can't take all of these people. Let's cap it. That's why you can see just 150 at the end of the day. And today we have half of them here. Tomorrow, another half. So I want to make a humble request to the African Institute. Many of our colleagues in the ministry, in our universities, they are also already quite willing to be part of us. So we need a second round of this fellowship for us to accommodate all and sundry who are desired to be part of this. Please, CEO. Notwithstanding, I want to say, CEO, I want to challenge you that this is the biggest constituency in Africa you have today. If that's the case, I think we are qualified, we are eligible to be considered for the next conference in 2026. We are going to South Africa in November. I'm part of the planning committee, but now, with the Honorable Minister here, we are feeling that 2026 should be free turn. You can see, right? So we'll make you proud. With that, I'll come back to you. If you were taking the role of your father or your mother, who are you today? A farmer. Maybe I would have been an Islamic cleric, an imam. Right? I'm not seeing any Aneskoma here. No any mother view here. Just be humble. If your mother was a farmer, same for your father. Today we are here as accomplished practitioners. I think we owe them. And when I was given that invite, I brought in only my wife and not my father, not my mother. Maybe there are no more. So I want us to really say a big thanks to them, to our parents, who are not here today, or who are still around, and they make it possible for us. Dr. Carol was saying her mother was shedding tears. Oh my God. Oh, she's here. Thank you, Mom. Right? So they are all absent. Let's appreciate them. And again, I want to say, you have to say thank you to your father, your parents, for living. But if you are living so well, you owe it to your teachers and mentors. Abu Kwante, my teacher. Dr. Ahmed Bandi, my teacher. But notwithstanding, my CMOs are here, the ministers are here. I work through them. And my colleagues, senior colleagues, they are all mentors. This day, I want to dedicate this day today to you all for the support, for shaping forward. And I promise you, we're going to deliver this chapter for the good of our people. Thank you very much. Thank you.
Yes, thank you very much. Before I forget, I am so elated having Dr. Austin Demby the Honorable Minister of Health. Like I said yesterday, that Dr. Fuad Kanu has been lobbying us, the Institute, to come for our 8th edition of International Conference. Next year in Freetown here. Honorable Minister, sir, I want to say on behalf of the Governing Council of African Institute of Public Health Professionals that you are going to receive guests across the continent of Africa come next year for our 8th edition of International Conference. This year we are going to be in South Africa. Like I told Dr. Kanu, that we have already settled for South Africa. But by the grace of God, we'll be here next year for the 8th edition. Thank you very much. It is my great honor to invite the Honorable Minister to be decorated. And of course, apart from being fellow of the Institute, he is still a goodwill ambassador of African Institute of Public Health Professionals. A goodwill ambassador of the Institute. When we get back to Nigeria, we are going to send that goodwill ambassadorial plaque. Thank you very much, sir.
Distinguished ladies and gentlemen, permit me to stand on the existing protocol, and I must say it is an honor to read the citation of the Honorable Minister. Dr. Dembi currently serves as the Minister of Health for the government of Sierra Leone, bringing to this role a distinguished career that spans over 4 decades across continents and institutions. He began his public health journey in 1980 as a research scientist at the Center for Disease Control and Prevention, later serving as country director for CDC Field Station in Sierra Leone, where he made significant contributions to the understanding of Lassa fever. Throughout his illustrious career, Dr. Dembi has held key research appointments in world-renowned institutions in the United Kingdom and the United States. As a founding member of CDC's Global AIDS program, he played a transformative role in establishing and expanding HIV and AIDS programs across Ethiopia, Rwanda, Tanzania, Zambia, and the Democratic Republic of Congo. As the director of CDC Malawi program and later deputy principal for the President's Emergency Plan for AIDS Relief, Dr. Dembi oversaw and managed critical U.S. government global health investments totaling over $2 billion, strengthening health system and saving lives across Africa. In 2014, during the devastating Ebola outbreak in West Africa, Dr. Dembi stood at the forefront of the global response as the first U.S. official to conduct a rapid technical assessment in Sierra Leone. He raised the alarm and deployed multiple times in service of his homeland and humanity. Dr. Dembi's academic achievements include a doctorate in clinical microbiology from the University of London, a Master of Public Health from the University of Michigan, a Bachelor of Science with honors from Fora Bay College, University of Sierra Leone. For his pioneering contributions, visionary leadership, and legacy in global health, I present to you the Registrar of African Institute of Public Health Professionals to induct Dr. Dembi as a Fellow of African Institute of Public Health Professionals. Thank you very much.
I want to invite Professor Mohamed Kano and other old fellows, including the chairman of the council, to help us decorate the Honorable Minister. I also want Dr. Conte to be there because in my country we are gender sensitive. Yeah, gender sensitive. Dr. Conte, please.
Yes. Thank you. It's long enough.
On behalf of the Governing Council, fellows, members of African Institute of Public Health Professionals, I present this meritorious award to you, Dr. Austin Dembi, as a fellow of African Institute of Public Health Professional towards your selfless contribution to healthcare development and safety of mankind in your country, Sierra Leone, in the continent of Africa, and all over the world. Congratulations, sir. I need this picture so that I can be proud that I snap with the minister.
Yes. Take a serious one, government one.
Thank you very much. Comes with a certificate.
It's up.
Okay.
Look at the microphone.
Please, all the senior officials of the ministry, you can come out and snap with him, including the chairman of the chapter. You don't need to keep him with you.
Cordless mic. They don't have a mention.
Where is Mr. Conte? Where is he? Our big Conte. Is he coming? make that. Sorry, please. I have one of my colleague from Nigeria. My colleague from Nigeria, I want to take a picture with the Honorable Minister. Sorry. My colleague want to take a picture with Honorable Minister, please. Sorry. No. That's for him. That's for him. Group induction.
This group induction for the senior leadership.
Yeah.
Okay. So we just call them on stage.
Okay, we should just call them on stage.
Yes, better.
Then their citation.
Yeah, skip. Summarize. No, you can't skip it. Summarize.
Okay. So I should just call all of them on stage. All right, thank you very much.
No, the content need to be read.
No, we are reading all the citations. I don't know how we do this now.
No, let them come.
Can we have Professor Dr. Charles Senisi on stage, please? Professor Dr. Charles. Please, let's make him feel welcome.
Hello. The Honorable Minister has to leave to another event to attend another important event. Could we all rise and allow the Honorable Minister to take his leave? Thank you.
Yeah, thank you. Professor Charles is a medical doctor and an associate professor with over 10 years professional experience in the field of medicine and public health. He holds a Bachelor of Surgery and Bachelor of Medicine degree, master's degree in dermatology, and a PhD in health sciences on international health research and education, USA. And he's currently pursuing another PhD in public health with major in epidemiology. He is the founder and president of the UN ECOSOC, an accredited Afro-European medical and research network which mobilizes diaspora health practitioners for medical missions in sub-Saharan Africa. He was featured in the most influential contemporary African diaspora leaders alongside Visionary Leadership Award in Health 2023 USA. He's currently the Deputy Minister of Health 1 in the government of Sierra Leone. The registrar, please. Please, let's put our hands together for him. Okay, he went to... Dr. Jalikatu Mustafa, please get ready. She's not around, okay. Dr. Sati Kenny, please get ready.
On behalf of the Governing Council, fellows, and members of African Institute of Public Health Professionals, I present this award to you, Professor Dr. Charles Senisi, as a fellow of African Institute of Public Health Professionals towards your selfless contribution to healthcare development and safety of mankind in your country, Sierra Leone, in Africa, and indeed all over the world. Congratulations.
Congratulations, sir. Dr. Sati Mohammed Kenny, please. Can we have you? Congratulations, sir. Please let's put our hands together for him. Dr. Sati Mohammed is the Chief Medical Officer of the Ministry of Health in Sierra Leone. He is a Principal Technical Advisor to the Government of Sierra Leone in all health-related matters. Dr. Kenny is also the professional head of all medical practitioners in the public service in the country, providing technical and supervising the Deputy Chief Medical Officers, directorates, and programs within the ministry. He's a highly accomplished and respected clinician and public health professional experience within the Ministry of Health through the entire spectrum of service delivery. Prior to his appointment as CMO, Dr. Kenny served on all the rungs of the Ministry of Health service ladder. Due to his outstanding performance in this role, Dr. Kenny was elevated to the position of Director of Reproductive and Child Health in 2018. In August 2020, Dr. Kenny was appointed as the Chief Medical Officer responsible for public health and later elevated to the Acting Chief Medical Officer in November 2021 and confined a year later as a substantive Chief Medical Officer. He holds a Bachelor of Medicine and a postgraduate diploma in pediatrics from Shanghai, Second Medical University in China, and a Master of Public Health from the University of Ghana. Additionally, Dr. Kenny is a distinguished fellow of the Sierra Leone Postgraduate College of Physicians and Surgeons, as well as a fellow of the West African College of Physicians. The registrar, please.
On behalf of the Governing Council, I present this meritorious award to you, Dr. Kenneth, as a fellow of African Institute of Public Health Professional towards your selfless contribution to healthcare development and safety of mankind in Sierra Leone, your country, and indeed all over Africa. Congratulations, sir.
Can Dr. Ishata Nani Conte please get ready? Okay, please take the stage, ma. Dr. Ishata Nani Conte. She is the team lead for the Emergency Management Support Unit within the WHO Emergency Response Program at the World Health Organization Regional Office for Africa. She's a public health expert, emergency management specialist, and health system strategist with extensive experience in epidemic preparedness and response, health system strengthening, and operational risk management. She has worked for WHO and UNICEF in various capacities for the past 13 years. Prior to our current appointment, Dr. Conte served as the technical officer for country readiness at the WHO, where she provided strategic guidance to 47 WHO country offices and member states in emergency preparedness and response. Dr. Conte has over 25 years of experience in public health and program management at both national and international levels, having worked in areas such as epidemic response, immunization, malaria, and workforce development. She has played a pivotal role in major outbreaks, including Ebola, cholera, and polio response efforts in Sierra Leone. Dr. Conte has dedicated much of her career to improving emergency response capacity in Africa and has authored over 26 publications in peer-reviewed journals. Dr. Conte is a certified state-registered nurse and certified midwife. She's a fellow of the West African College of Nursing and a foundation fellow of the Sierra Leone Postgraduate College of Health Specialties. She has received multiple awards for her outstanding contributions to emergency response and public health. The registrar, please.
On behalf of the Governing Council, the fellows, members of African Council of Public Health Professionals, I present this meritorious award to you, Dr. Ishata Nani Conte. As a fellow of African Council of Public Health Professionals, for your contribution to healthcare development and safety of mankind in your country, Sierra Leone, all over Africa, and indeed all over the world. Congratulations.
Congratulations, sir. Please, Dr. Mustafa Kaba, please get ready. Dr. Mustafa Kaba. Congratulations, ma. Please, let's put our hands together for her. Dr. Mustafa Karba is the Deputy Chief Medical Officer, Clinical Services at the Ministry of Health, Sierra Leone, a consultant surgeon at Keynote Hospital, and a lecturer at the College of Medicine and Allied Health Sciences. With over 20 years of experience in surgery and healthcare leadership, he specializes in general and visceral surgery and proctology, bringing extensive expertise to his role. Dr. Kaba obtained his Bachelor of Medicine and Surgery from the College of Medicine and Allied Sciences, Sierra Leone, before furthering his medical career in Germany. He earned a Doctor of Medicine from the University of Bonn and completed specialized training in surgery under the German Medical Board. Beyond his clinical work, Dr. Kaba also plays a pivotal role in health system strengthening and policy development. As chairman of the Sierra Leone Medical Board, he provides strategic oversight of medical regulations and emergency medical services. Additionally, he is spearheading an establishment of a national dental school in partnership with Mercy Ships, a significant step toward expanding the country's oral health care capacity. Dr. Kaba is a fellow of the West African College of Surgeons and a foundation fellow of Postgraduate College of Health Specialties, Sierra Leone, underscoring his dedication to medical education and professional development. He also serves as an inaugural board member of the Pan-African Surgical Healthcare Forum. is a recipient of the Commander of the Order of Rokel, one of the Sierra Leone's highest national presidential honors. Dr. Kaba remains committed to advancing surgical innovation, medical education, and equitable health care access. Please, let's put our hands together for Dr. Kaba.
On behalf of the Governing Council, fellows, members of African Institute of Public Health Professionals, I present this award, this meritorious award, to Dr. Mustafa S. Kaba, as a fellow of African Institute of Public Health Professionals, for his contribution to healthcare development and safety of mankind in his country, Sierra Leone, in Africa, and indeed all over the world. Congratulations, sir.
Congratulations. No, it's the remaining. Excuse me, sir.
Okay.
Please can Professor Francis Chisaka Kasolo get ready? All right, Professor Francis Chisaka Kasolo. Please, let's put our hands together for him. Professor Francis is the Director and Head of World Health Organization Office to the African Union and UN Economic Commission for Africa. He is an infectious disease physician and public health expert with specialization in clinical virology. He has also worked for WHO in various capacities for the past 22 years. Prior to his current appointment, Professor Kasolo was the WHO representative to Ghana with responsibilities for overseeing the organization work. He has over 37 years of experience in public health and program management at both national and international levels, having worked in areas such as global health, organization reforms, immunization, HIV/AIDS, emergencies, and clinical virology. He has committed much of his professional life to addressing the health challenges faced by mothers and children in Africa and has authored over 90 publications in peer-reviewed journals. Professor Kasolo is a holder of the following qualifications: Bachelor of Medicine and Surgery from the University of Zambia, Master's degree in Public Health, and a Doctor of Philosophy degree in Clinical Virology from the London School of Hygiene and Tropical Medicine. He also holds a Diploma in Tropical Medicine from the Royal College of Physicians, England. He is a Fellow of the Royal College of Physicians of Edinburgh and Fellow College of Physicians for East, Central, and Southern Africa. Congratulations, sir. Please put your hands together for him.
On behalf of the Governing Council, the fellow management of African Institute of Public Health Professionals, I present this meritorious award to you, Professor Francis C. Kasolo, as a fellow of African Institute of Public Health Professionals towards your selfless contribution to healthcare development and safety of mankind in your country, Zambia, in Africa, and indeed all over the world. Congratulations, sir.
Congratulations, sir. Okay. Congratulations once again, sir. Please, let's put our hands together for him. I would now like to invite Dr. Ishata Nani Conte to give the keynote address on building a resilient health system for universal health coverage and health security in Sierra Leone. Please, let's put our hands together for her.
Traditionally, in our institutes, we wear special gown for our keynote speakers. So please, where is the... to her. Can you go and help decorating?
It's better, let me hold it.
Mr. Chairman, Honorable Deputy Minister of Health, Professor Charles Senesi, alias PD, Chief Medical Officer, CEOs of the Africa Institute of Public Health Professional and the Institute of Health Professional Development, members of the United Nations and the Diplomatic Corps and Consular Section, senior health officials, distinguished inductees, members of the media, distinguished ladies and gentlemen, I say good afternoon. It is a distinct honor and privilege to deliver this keynote address today on a topic that is not only central to our shared vision and commitment as public health professional, but deeply personal to me as a Sierra Leonean and a public health leader. I would like to extend my profound appreciation to the chief executive officers and the organizers for their exemplary leadership and strategic foresight in initiating and convening this landmark event. Today marks a historic moment in Sierra Leone as we officially join our counterparts across the continent as fellows of the African Institute of Public Health Professionals. We also take a great pride in launching our national chapter. This milestone not only reaffirm our commitment to advancing public health excellence, but also strengthen our creative determination to foster a more connected, professional, and empowered public health workforce. This afternoon, I have the distinct honor of reflecting the theme of this important event, building a resilient healthcare system for universal health coverage and health security in Sierra Leone. I invite you all to join me in a thoughtful exploration that reflects parts of the work I did during my doctoral research in Sierra Leone in 2023. And I appreciate some things may have changed. It highlights the progress we have made, acknowledges the ongoing challenges we continue to face, and draws on the valuable lessons we've learned. Together, we will also examine the significant opportunities that are available for us to strive to strengthen a health system that is not only resilient, but also inclusive, equitable, and responsive to the needs of all Sierra Leoneans. Mr. Chairman, Honorable Minister, distinguished ladies and gentlemen, I will begin by grounding our discussion on the fundamental definitions that frame the theme of today's event, building a resilient health system for universal health coverage and health security in Sierra Leone. The World Health Organization defines a resilient health system as one that effectively responds to health emergencies while maintaining the delivery of essential health services. This entails the capacity for us to absorb, adapt, and transform in the face of shocks, such as pandemic, natural disaster, or conflict, without collapsing. In essence, a resilient health system bends under pressure, but does not break. It is important to recognize that universal health coverage is both a goal and a critical pathway to achieving resilience. Universal health coverage is a central element of the Sustainable Development Goal, particularly Target 3.8, and is defined as ensuring that all individuals receiving health services they need, when and where they need them, without incurring financial hardship. At its core, universal health coverage rests on three fundamental pillars: equitable access to service, high-quality care, and financial risk protection. It is important to note that universal health coverage does not only imply free access to all services for everyone, but rather a progressive, prioritized expansion of coverage shaped by national needs, policy decisions, and available resources. When effectively implemented, universal health coverage reinforces the resilience of health systems by ensuring that service delivery remains inclusive, accessible, and sustainable, especially in times of crisis. Health security, on the other hand, refers to the set of activities and capacities required to minimize the risk and impacts to acute public health emergencies that threaten the health and well-being of the population. Its key components include preparedness, early detection, effective response system, cross-border collaboration, and transparent risk communication. Together, these elements are essential for safeguarding communities against a health emergency and ensuring a coordinated, timely, and effective response. Distinguished ladies and gentlemen, we have seen how the spread of diseases like Ebola, Zika, Mpox, COVID illustrates the global reach to local outbreaks. These are not just public health events. They threaten economies, national security, and political stability. That is why health security is not optional. It is foundational to global health governance. Let us now consider the concept of public health resilience, a unifying thread that interconnects the principles of resilient health systems. Universal health coverage and health security. Public health resilience refers to the capture of public health systems, communities, and individuals to prevent, prepare for, respond to, and recover from the health emergencies while maintaining the essential functions and continuing learning from the crisis to enhance future performance. Closely aligned to the concept of public health resilience is the principles of system thinking, an approach that views health systems as interconnected, interdependent, and dynamic. It emphasizes the need for integrated and coordinated solutions that account for the ripple effects of actions across the entire system. By moving away from the silo of fragmented response system thinking enables us to design sustainable interventions, reinforce resilience, and ensure that each component of the health system contributes meaningfully to the performance and stability of the whole. Mr. Chairman, Honorable Minister, distinguished ladies and gentlemen, let me now contextualize this concept with Sierra Leone's own experience. Our country bears the indelible mark of war, outbreak, and hardship. These scars are part of our history, but so too is a powerful, unshakable spirit of resilience. After the 2012 cholera outbreak, there was a cautious optimism that we were turning a page and we are ready for all health emergencies. I recall vividly it took us about 2 weeks to confirm a case of cholera. We had to ship the samples out of Sierra Leone. Our National Public Health Laboratory, though established in 2005, was under-resourced, understaffed, and unprepared for emergency diagnosis. Its priorities were shaped by donor-driven vertical programs like the tuberculosis program, the HIV program, to name a few, leaving clear gaps in system-wide preparedness. But then came 2014 when we had the Ebola outbreak. With it, a devastating reminder of the fragility embedded in our health systems. Despite the years of investment, our foundation proved neither agile nor sustainable. But we are not defined by our setbacks. We are defined by our response. Today, Sierra Leone is rebuilding. We continue to face real challenges such as maternal and child mortality, rural-urban disparities, and underfunding. But we also have new generation of leaders committed to charting a different course. We are witnessing progress that gives us hope. We now have clear strategic visions, like the National Health Sector Strategic Plan, which is anchored in resilience, equity, and people-centered. Our Universal Health Coverage Roadmap, the National Action Plan for Health Security. We are building stronger emergency workforce through our community health workers, the AVOC surge, the Aiphp programs, to name a few. We launched the National Public Health Agency in 2023, a critical platform that is needed by member states for coordination, leadership, and accountability when responding to health emergencies. Our health financing strategy aims to reduce out-of-pocket costs and promote sustainable domestic funding through mechanisms like the Social Health Insurance Scheme. We've institutionalized integrated disease surveillance and response at all levels, which are strengthening our early detection. We have digital tools like the DHIS2, the M-Supply, the Open LMIS, to name a few. They're all improving data management and supply visibility and reliability. We've learned from the past. So during the COVID, our response was more decentralized and better coordinated. We maintained essential services, including immunization. That, colleagues, is resilience, continuing to serve even in the midst of crisis. But let us be clear, progress does not mean perfection. And as we advance, we must confront the challenges that remain. Our health workforce remains severely constrained, with just 0.3 doctors per 1,000 population, far below the WHO's minimum standards. We face critical shortages. Half of our health workers remain unsalaried. The rural-urban divide further undermines the equity. Health financing is unstable. Over 60% of total health expenditures comes directly from families. Government allocation remain below the Abuja targets. Donor support, while vital, is inconsistent and often fragmented. Supply chain bottlenecks lead to frequent stockouts, particularly in hard-to-reach areas. Emergency preparedness remains uneven. Fewer than 30% of districts do conduct simulation exercises. Despite the launch of the National Public Health Agency, coordination and integration at sub-national levels are still evolving. The One Health approach has not yet reached full operationalization. Climate risks are amplifying every vulnerability. If you remember, in 2017, August, Freetown mudslide, which took over 1,000 lives, it was sobering a reminder on how environmental instability intersects with public health. And there's more. We must reckon the fragmentation of our systems. Donor-driven programs, while well-intentioned, often bypass national systems, creating parallel structures, inefficiencies, and undermining country ownership. A resilient health system must be nationally led, integrated, and people-centered. Distinguished guests, Sierra Leone's journey is a testament of both the cost of neglect and the promise of reforms. Our story is not despair, but of determination. We have turned lessons into reforms, challenges into momentum. Yes, the road is long, but these challenges are not insurmountable. What they demand is honest conversation, courageous leadership, and above all, a unified vision. A vision of a health system that does not just survive shock, but is built to anticipate, absorb, adapt, and transform in their wake. Let us recommit today. Policymakers, partners, health professionals here in this room, to advancing a health system that is resilient, inclusive, and worthy of people it serves. Distinguished ladies and gentlemen, Honorable Minister, partners in the room, despite the persistent challenge we face in Sierra Leone, stands today a pivotal moment, one rich with opportunities to accelerate progress and transform our health system into one that is resilient, inclusive, and future-ready. We are witnessing an early sign of new era in health transformation. Digital health and artificial intelligence offer transformative promises. Platforms like the DHIS2, the M-Supply, Open LMIS, to name a few, are already enhancing disease surveillance, strengthening supply chain management, and improving real-time visibility of the health data. Mobile technologies are opening pathways to telemedicine and health education, even in our remote communities. A robust One Health approach is taking shape. The 2023 Zoonotic Disease Prioritization Workshop laid a groundwork for integrated collaboration across the human health, animal health, and the environmental health. Our community health workforce is expanding and presenting one of our most valuable and underutilized assets. With over 60% of our population under the age of 5, we are poised to unearth a powerful demographic dividend. If we invest wisely in education, digital skills, and leadership development, this youthful population will become the engine of innovation and resilience. Fellowship programs such as the one being celebrated today are already nurturing the next generation of public health leaders. Our regional and global partnerships are growing stronger. Institutions such as WHO, the Africa CDC, UNICEF, World Bank, and the Global Fund continue to play a pivotal role in supporting preparedness, financing, and system strengthening. We must engage these partners with clarity, alignment, and national leadership at the forefront. Data-driven decision is gaining traction. The integration of dashboard, geospatial mapping, and predictive analytics is improving our ability to plan, target intervention, and respond rapidly to emergency threats. These are not distant dreams. They are concrete foundation for transformation. Colleagues, Honorable Minister, it is within our grasp to build a health system that is not just reactive, but proactive. Not just resilient in crisis, but responding in every season. Not just serving the few, but protecting the many. The opportunities before us are real. The momentum is undeniable. So, what must we do collectively and with urgency to build a resilient health system that Sierra Leone both needs and deserves? We must strengthen our health workforce, not just in numbers, but skills, distribution, and motivation. We must advance sustainable health financing. The primary health care must be the foundation of our systems. It is both the gateway to universal health coverage and our frontline defense during health emergencies. We must also invest in modern climate resilience infrastructures and logistics. At the same time, governance and coordination must be strengthened. We must also scale up real-time surveillance and early warning system. The One Health approach must be operationalized. Above all, we must center our efforts on equity, gender, and community voice. A system that excludes the most vulnerable is not resilient. Let us prioritize inclusive policies that uplift women, children, persons with disabilities, and rural population, ensuring no one is left behind. Distinguished ladies and gentlemen, the way forward is not a single reform or isolated program. It is a comprehensive, coordinated transformation in how we deliver, finance, and govern health. Sierra Leone has the tool. We have the talent, and with your continued leadership, we have the will. Take community-based surveillance, for example. It improves outbreak preparedness and strengthens maternal and child health through early risk detection. System thinking empowers us not just to recover, but to advance. It enables us to design systems. Be bold. Lead with integrity, evidence, and empathy. Innovate, collaborate, and always keep the needs of the most vulnerable at the center of your work. To our policymakers, prioritize people. Invest where it matters most. In community systems, the health workforce, primary health care, and equity. The return on these investments is resilient. To our partners and donors, stay the course. Align your support with our national strategies. Invest in what lasts, in institutions, in systems, in people. Work with us not only in moments of crisis, but through every phase of our development journey. This is not just a call. It is a once-in-a-generation opportunity to reimagine and reshape our health system to serve everyone, everywhere, and every day. Not only when disaster strikes, but as a lasting foundation for health, dignity, and development. Let me borrow the phrase of an American entrepreneur and actor, "That man." So you see, we all have a role to play. Let this conference be a turning point. Let it mark our collective commitment to systems thinking, coordinated action, and sustained investment. As we walk out of this auditorium today, remember that resilience is not built in moments of crisis, nor in times of quiet or calm. It is built in the choices we make every single day, and it is sustained through vision and action. Let us be the vision, and let us be the action. I thank you all for your attention.
Please give a big round of applause again to our keynote speaker. Let us be the vision and let us be the action. I think those are very good parting words. I know it has been a very long morning already, and ATP is getting low, so some ATP needs to be replenished. I think the speech by our keynote speaker covered a lot of areas. One thing that strikes me the most, and which is significant with public health, is being a systems thinker. Systems thinking is everything that encompasses public health. And everything is interconnected. Everything is interdependent on one another. So that's the differentiation. By being a public health professional, you begin to think systems. And today, when we look at the realm of public health, and especially as it pertains to us in Africa, you see, you can do public health in the US and you do public health in Europe and other places. But one thing that is important too when we do public health in Africa is to understand the layer of our African cultures. That in Africa, everything about our systems. So we have to bid farewell to our Honorable Deputy Honorable Minister. Everything about our systems is about community, it's communal. In the US, it could be very individual. Everything about you can be individual. You have your right. Everything is sort of me, and there is a right-based system. For us in Africa, there is a layer of community. and that layer of community and communal connectedness, it takes on a more humanistic value. And so the concept of humanism, concept of moral duty, concept of solidarity, participation becomes important in our thinking around public health. And we must also not forget that the social element becomes more important. That then the social science, the anthropology, indigenous method systems, our own spirituality. Most of our public health programs in this country, we are not even teaching music and dance as a form of healing. That is a central part of healing in our African systems. Spiritual music, spiritual dance, all these societies you see, the Bondo, the Poro, all these societies have an element of public health, and they've all been part of also protecting environment and protecting the watersheds. And today, as you do a lot of One Health research, you know when you protect the watershed, you actually reduce diarrhea downstream by a whole lot more. So some of these things have been within our systems, and we need to dig back and need to rethink and need to reimagine and move away sometimes from some of the models of thinking that we are trained in Europe or America or other places, and think about African-centered public health. And we need to begin to be people who are putting out ideas and new paradigms of thinking, rather than just being data collectors and people who are just simply collecting information that we are gathering from other parts of the world. And that means that our systems, we have to go back to some of our systems and think about how do we bring back those systems in terms of addressing public health systems and building resilience. And that is why I like what our keynote speaker talked about, community-based resilience, building community resilience, community-based systems. One Health. One Health is largely an African thing. You know, they made it, they reconnected the world and developed it and packaged it back to us. But you all know, every village, I mean, we live with our goat, the sheep, the cow, the monkeys are around us, the forest is around you, the community is interacting with the forest, the rivers are all around us. Our people thrived on One Health based on first principles of conservation, first principle of building around the little things you around. You are not supposed to cut this. You are supposed to live with nature. Those were first principles. That's One Health. Now we are going to planetary health, which is coming back again to our African indigenous systems, understanding our values and all those things. That is what public health is doing. And we here, you the professionals, today should be the one leading it back into the community, because our communities are relying on us. They see us as the people who know ideas, who know stuff. But we need to go back and meet them and reconnect that idea and learn from them, because we need to learn from them. We can't just take things and take it to them and say, this is your thing, this is how we do stuff. Like for instance, there is anthrax, you come with a case definition. This is what anthrax looks like, you show them. No, they should actually be telling you what they are seeing. And it should be based on that community-based surveillance and community-based thinking. So I'm very happy today, and I think my work is ending here, because sooner or later I will be on the road to go to Kabbalah, which is my favorite place to be at this point. But I'd like to thank everyone. I think there should be tea break. We are heading to tea break, and then later on, I think the other parts of the programs will continue. But first, finally, I want to congratulate you all, and I really look forward to collaborating with everyone. Some of you I'm collaborating with already, but I think this is a good initiative. Want to thank the CEO of the Institute for Health Professional Development, Dr. Fuad, Professor Kanu, Mohamed Kanu. I want to thank the Chief Medical Officer, who's taking a lot of his day. Imagine the number of things he has to sign. That he's been here for how many hours now, and of this day. We want to thank him for being here all this through. The registrar from the African Institute of Public Health Professionals, all the way from Nigeria. I hope you're going to get some EBA and other stuff here. We have it all here. You actually, right here at Frobe, just go to Frobe, this road. From here, you will be in Nigeria. That's Frobe. You are right here. Yeah. And then I'd like to thank Professor Francis Casolo for being here with us. And I think this is a great opportunity for building synergy with the work that has been started here. And of course, Robert from WHO in country, Sierra Leone. And so again, I want to thank you all. Public health is everybody's business. Is the work of building communities that are thriving. And so it is a huge sacrifice. You may not have a lot of money from it. You may not have a lot of other things from it. But the joy comes from the fact that you are solving problems and you are also helping to build a thriving and productive society. So thank you very much. Thank you.
Even the Almighty want to be thanked. Let's thank the chairman of this open section. Thank you very much, Mr. President. I appreciate you. Of course, I can't say much again. Having the CMO and all other colleagues here, let's say all day, we are grateful. Quick announcement. Now proceed for the breakfast or lunch. Say breakfast on our side, right? And then what will happen after the breakfast? We'll all come back here and continue the induction proper. We have like 70 people to be inducted. We are a little behind time, but we'll see how we manage that. So we go this way, we have 2 rooms. This is the 3rd floor. 2 rooms there, enjoy your breakfast. My call is lunch. Thank you very much. Bon appetit.
Dr. Frances Fona, please. Aminata Kuruma, please get ready. She is a highly accomplished professional with extensive experience in nursing, midwifery, and public health. She holds a PhD in public health from Walden University, USA, a joint master's in public health, profession education. Dr. Fona is a fellow of the West African Postgraduate College of Nursing and Midwifery. She has a dedicated she's coming, Richard Campbell should please get ready. Matron Mary Fuller. Matron Mary Fuller is a results-oriented professional with an exceptional leadership and dedication to the nursing and midwifery profession. Currently, she's enrolled for PhD and holds a Master of Science in Public Health from the Leeds Metropolitan University, London. As she is the current chair of the Nursing and Midwifery Council, and she has contributed to the development of standard policy documents and accreditation of many health training institutions in order to increase health workforce in the country. Finally, in 2023, she was awarded the 35th position out of 100 most powerful, developmental, and influential people from Pojihun district. Please, I'm sorry about that. Please, let's put our hands together for her. Richard. Richard Campbell.
I'm using this because I've marked it already. So you should just tell me. Richard. Yeah.
Mohammed Ballo, please get ready. Richard Campbell is a seasoned clinical and community health professional with over 25 years of diligent and committed services, working with the Ministry of Health, Sierra Leone International Health Organization, and College of Medicine and Allied Health Sciences in the Ebola vaccine trial. He is currently the Chief Community Health Officer, charged as the Principal Advisor to the Medical Officer on community health practitioners. Additionally, he has worked as in charge at various community health centers, providing preventive, clinical, administrative, and community health care services to his catchment and population. Congratulations, sir. Please, let's put our hands together for him. Mohammed Ballo. Mohammed Ballo, please.
Any relative? Mbijalo? No? Okay.
Okay, Dr. Alhassan Lance Sisse. 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 Dr. Sas. Kabu.
And Dr. Ian.
Okay. Can we have Dr. Ian Wore and Dr. Sas Kabo on stage, please, to assist in decorating the new fellows?
Thank you so much.
Welcome, sir. Dr. Al-Hassan is a fellow of the West African College of Physicians and member of the Sierra Leone Medical and Dental Association. He is a public health specialist in the Ministry of Health, a member of the Polio Eradication Committee, and also a member of the National Immunization Technical Advisory Group. He is a part-time lecturer on health policy in IPAN, University of Sierra Leone. He has traveled widely representing the Sierra Leone health service story in many health fora covering Ghana, Kenya, Tanzania, Japan, USA, China, and the UK. Congratulations, sir. Fatu Yunkela.
Any relation? She's away.
Dr. Tom Sise. While Dr. Tom is coming out, Dr. Brima Kamara, please get ready. Dr. Tom is the current Director of Policy Planning and Information of the Ministry of Health in Sierra Leone. He's an experienced medical officer and public health specialist with over 20 years of experience in health services in Sierra Leone. He has a medicine degree from the College of Medicine and Allied Sciences of the University of Sierra Leone and a master's degree in public health from the University of Ghana. He was appointed as the Director of Reproductive and Child Health Directorate for a period of 3 years from 2018 to 2012. Dr. Tom has attained a postgraduate diploma in various disciplines, including health system management, maternal and child health, health policy and formulation, and health system reforms. Please, let's put our hands together for him. Dr. Brima. Brima Osai Kamara. Okay, Dr. Brima Osai Kamara. Thank you very much. He is a distinguished, Dr. Kamara is a distinguished public health specialist. He has extensive experience spanning over 20 years working with the Ministry of Health and international NGOs in Sierra Leone and beyond. He is the current Director of Public Health Care in Sierra Leone. His dedication to public health service and visionary approach to health governance has earned him widespread recognition both nationally and internationally. Please, let's put our hands together for Dr. Brima Osai Kamara. Professor Rashid and Sumana.
Rashid and Sumana, please come and take it. Relative.
Okay, they are not reading the citation. He's not here, so there's no need. Yeah. While she's coming to represent him, can we have Dr. Ahmed Vandi, please? Ahmed Vandi. He has it already now. He has it down already.
He has it down.
He has it down already.
Yeah. Yes. I saw him yesterday.
Thank you very much. Dr. Ahmed Vandi, please. He graduated with a Community Health Officer Certificate in 1988. He proceeded to do a diploma in community health at the African Medical Research and Educational Foundation in Kenya. He later obtained a postgraduate diploma and Master of Science in the Control of Infectious Diseases at the London School of Hygiene and Tropical Medicine. Dr. Vandi is working with the Partnership for Resilience Projects, referred to as PARIS, NIHR-funded consortium focused on researching and developing strategies to build resilience in communities, particularly in crisis situations, by identifying best practices and engaging communities effectively in response efforts. Congratulations, sir. Joseph Sinesi.
Joseph Sanasi.
Is he here? Please, let's put our hands together.
47.
He said 26.
26. Okay.
While he's coming out, Dr. Joseph Idem Hotta, please get ready. Joseph Victor is a seasoned public health scholar practitioner with over 30 years professional experience in public health. He's currently completing a Doctor of Public Health degree from Walden University, United States of America, for his academic excellence at Walden University. He received awards such as Golden Key Membership and National Society of Leadership and Success. In 2010, Joseph joined the United Nations Children Fund as nutrition officer and then nutrition specialist. In 2014, Joseph was reassigned to UNICEF South Sudan as nutrition specialist. Currently, Joseph Victor is the UNICEF officer in charge, Chief of Field Office and Nutrition Manager in Maiduguri, Nigeria. Please let's clap for him. Maiduguri, Nigeria. I'm particular about that. Joseph, you do have him. Is he there?
Is he here?
Joseph is there.
Is he up?
Yeah.
Is he on the stage already?
No. It's got it.
Please, Joseph Eden Hotta, while Dr. Lawrence Babao, please get ready.
He's on. He's Joseph.
Joseph Eden graduated with a Bachelor of Arts in Health Promotion Nursing at the University of East London in Britain in 1995. He obtained his Master of Public Health from the University of Leeds, Master of Public Health from London School of Hygiene and Tropical Medicine. His expertise in health promotion and disease prevention, particularly in underdeserved population, has had a lasting impact on public health initiatives in Sierra Leone and internationally. Presently, Dr. Joseph serves as the Dean of the Faculty of Nursing and Midwifery and the Head of Community Health Nursing in the College of Nursing and Allied Sciences University of Sierra Leone. Congratulations, sir. Dr. Lawrence. While Dr. Lawrence is coming, okay, can we have Dr. Titi Samba to come on stage and support in decorating his genius in the Institute? Please, let's put our hands together for him as he comes forward.
Dr. Lawrence,
Dr. Lawrence is a prominent academic and researcher based in Sierra Leone, currently serving as Dean of Postgraduate School at the Eastern Technical University of Sierra Leone. He holds a PhD in public health, specializing in infectious disease, health system strengthening, health policy, and climate change. Dr. Babao has served as a member of the Scientific, Technical, and Advisory Group for Emergencies on COVID-19, appointed by the President of Sierra Leone when the COVID-19 pandemic broke out. He was recently appointed as Commissioner of the Tertiary Education Commission, responsible for the Eastern region of Sierra Leone. Please, let's put our hands together for him.
The support, right?
Dr. Frances Fona, please come on stage and assist in decorating your genius. Dr. Angela Magdalene George, please can you come forward? Dr. Angela. Is she here?
Yeah.
Okay, you're welcome, ma'am. While she's coming, Dr. Carol Labor, please get ready. Dr. Angela is a distinguished research scientist, public health specialist, and a United States Tech Human Fellow with over 15 years of expertise in health sciences research, human nutrition, humanitarian emergency response, and gender-inclusive public health management. Dr. Angela George continues to shape policies and healthcare delivery through mentorship, research, and strategic partnership. Please, let's put our hands together for Dr. Angela. Okay. Dr. Carol Labor. While Dr. Carol is coming forward, Dr. Matthew Jusu, please get ready.
I wish there is another dancing competition here. Copy of Dr. Carol.
Dr. Carol is a trailblazing global mental health expert and Sierra Leone's first ever senior advisor on mental health, appointed by the President of Sierra Leone. She is the founder of Women's Wellness, a women-led non-profit organization designed with and for women, inclusive of survivors of SGBV, sex trafficking, and modern-day slavery, women with disabilities, and women living with HIV. Dr. Carol is a pioneer of a global recognized gender-centered MHPSS training and certificate programs, responsible for the design and development of Sierra Leone's national framework for scaling up the accessibility and availability of mental health and addiction services for over 8 million people in Sierra Leone. Congratulations, ma'am. Dr. Matthew. While Dr. Matthew is coming forward, Osanatu Americano, please get ready. Dr. Matthew is a public health ophthalmologist, an exceptional, hardworking, enthusiastic, analytical, communicative, and humble doctor who has worked for over 30 years. He's a senior lecturer in ophthalmology. He was the Dean of Faculty of Nursing for 4 years at the College of Medicine and Allied Sciences, University of Sierra Leone. Dr. Matthew is married with 3 children. He's a devout Christian. He's presently the Vice Chairman, Parish Pastoral Council, and Chairman, Catholic Men Association of St. Martin's Parish, Blackhall Road, Freetown. He's also the Vice President of the Archdiocesan Catholic Men Fellowship, Catholic Men Association. Sorry, congratulations. Hosanatu Mary. While she's coming, Margaret Titi Mani, please get ready. Margaret Titi Mana. Maybe before I go back to Nigeria, I'll need classes on how to pronounce Sierra Leone names, right?
Sanatsu. Okay, she's Margaret. Okay. Margaret is what page?
Look at her.
No.
Sanatsu.
Living. Sorry, what's her name? Margaret. Oh, I didn't read Rosinatu.
Okay, sorry. Rosinatu holds a Master in Public Health degree from Njala University, Sierra Leone. She is a state certified. She has a state certified midwifery certificate at National School of Midwifery, Freetown, Sierra Leone, and a state registered nursing certificate at the National School of Nursing, Freetown, Sierra Leone. She has earned herself various awards for her exceptional role, leadership, and dedication to work in the field of nursing and midwifery. Congratulations, ma'am. Margaret Sitimana, while she's here. Christina Masali, please get ready. Margaret Titi Mana is a renowned nurse, midwife, and a public health specialist with over 34 years of experience in maternal, newborn, child, and adolescent health, quality improvement, and health system strengthening. She currently serves as the program manager of the National Quality Management Program at the Ministry of Health. Margaret holds a master's degree in international public health and sexual reproductive health from Liverpool School of Tropical Medicine, UK. She serves as an associate lecturer at the College of Medicine and Allied Sciences. She's a board member of the Pan-African Institute of Quality, Health and Safety. Margaret has authored key national documents and contributed to national and international research studies on maternal mortality reduction, obstetric emergency care, and midwifery education reforms, influencing both national and global best practices. Congratulations, ma'am.
27.
That's Christina.
Yes, ma'am.
Is she here?
She's here, yes.
Okay. While Christina is coming forward, Elizabeth Tuka, please get ready.
Toka.
Elizabeth Tuka, please get ready.
27.
With Christina as well.
Yes, it's 27.
Toka is here, no? No relative?
Okay. Matron Christina Masali is a results-driven public health professional with a strong background in nursing and midwifery. She holds a Master of Public Health degree from the Njala University, Sierra Leone, a certificate in leadership and management from Washington University, USA, and currently she's focused on her doctorate degree in public health at the Tezila University. Matron Christina Masali's efforts, commitment to cause has not only proven the profession, but has also ignited the introduction of the internship program for newly qualified nurses. These transformative initiatives have redefined a benchmark for future generations of health professionals. Congratulations, ma'am. Elizabeth Tucker is not here. Can we have Dr. Michael Matthew Amara?
25.
Okay, sorry. This is Sese. Dr. Tom Sese. Okay.
Can we have Dr. Tom Sise and Aminata Shamit Koroma to kindly come up to assist in decorating the new fellows? Dr. Matthew Amara. Dr. Michael Matthew Amara is Sierra Leone's first health financing specialist with over 24 years of experience in healthcare, focusing on policy formulation, strategic planning, and management across both the public and private sectors. He contributed to key health sector policies and strategic plans, including the Health Sector Strategic Plan 2021 to 2025 and the Healthcare Financing Strategic Plan from 2021 to he leads the Sierra Leone Social Health Insurance Project, a major initiative for the President. His educational background includes PhD and MPhil in health financing, various postgraduate certificates from prestigious universities. Dr. Amara has also been involved in several consultancy projects such as costing national initiatives and conducting public expenditure reviews. His extensive research and evaluation work supports organizations like the World Bank and various local and international NGOs. Congratulations, sir. Dr. James Sylvester. Square.
44. Page 44. No rep.
Is he here? Oh.
No rep. Welcome, please. Come quickly. Okay.
Okay, while she's coming to represent Dr. James, can we have Harold Thomas?
Page 22. 22.
Harold Thomas, please, can you come forward? While Harold is coming forward, Dr. Patricia M. Ba, please get ready. Harold is a distinguished health promotion specialist with over 3 decades of dedicated service to public health in Sierra Leone. He currently serves as the Health Education Program Manager and the Risk Communication and Community Engagement Lead at the Ministry of Health. He's a fellow of the Royal Society of Public Health and a member of the Institute of Health Promotion and Education. His research contributions published include works on Ebola transmission, COVID-19, community perceptions, and post-outbreak health system strengthening. In recognition of his outstanding leadership, commitment, and impact on public health, Harold Thomas is awarded this distinguished fellow as a fellow of African Institute of Public Health Professionals. Congratulations, sir. Dr. Patricia. Is she here? Yes. She's already on stage. Okay. Dr. Patricia is a senior public health nurse consultant with expertise on adolescent sexual reproductive health and nursing leadership. She has an experience in maternal health with over 30 years within the Ministry of Health, United Nations Populations Fund, and Plan International Sierra Leone. She holds a doctorate degree in health system management and leadership from City University, a master in public health, East London in the United Kingdom, a master in clinical nutrition and dietetics, and BSc in clinical nutrition at Njala University, Sierra Leone. She has served as the Vice President of the West African Postgraduate College of Nursing, a position she held for 4 years. Please let's put our hands together for her, Dr. Patricia M. Barr. Congratulations, ma. Michael Ndoli. Michael Ndoli. Aminata Grace Kobe, please get ready.
Is he here? Is he here? Okay. So someone will pick for Aminata Kobe. Ndoli is coming.
Okay.
Ndoli.
Michael Ndoli, please. While Michael Ndoli is coming forward, Sawo Lebi, please get ready. Wait.
Ndoli, why waiting?
Michael is a Sierra Leonean who has spent his work life in the academic field as a public health professional. Currently, he is a staff of the World Health Organization country office in Sierra Leone with 22 years work experience, and as surveillance officer in charge of the integrated disease surveillance and response and international health regulations in the emergency preparedness and response cluster. Mr. Michael expertise in public health went beyond Sierra Leone as he has supported emergencies in Namibia, Tanzania, and Zanzibar, South Africa, Malawi, and Zimbabwe. He's a member of the global and WHO public health respondents with training and certificates in incident management, systems, leadership in emergencies. He has contributed to the development and revision of many public health guidelines, protocols, and policies within and outside Sierra Leone. Congratulations, sir. Should come and, okay. Can we have Mary Fuller and Dr. Abdul Mbawa to come and support in decoration, please? Thank you very much. Thank you. Okay, I thought she's not here.
No, someone to pick it.
Okay, Aminata Kobe, somebody's here to represent her. Then can we have So Lebi on stage, please.
Oh, yeah, lovely now.
Aminata Kobe, she's representing someone. Okay, she's the person. Oh, wow.
Okay.
So who is? Okay. Where is so?
46, page 46. Kobe. Yeah. Page 46. This is 43. So, which page? 46. Okay. All right. So, just give her to.
While So is here, Dr. Rashida Kamara, please get ready. Okay, So is an accomplished public health professional with over 2 decades of experience in the West, East, and Southern Africa. She's currently pursuing her PhD with the Tesila American University. She has contributed in making health impacts in Sierra Leone and beyond through life-saving initiatives. Notably, as a consultant for WHO Regional Office for Africa, she developed a regional guide for community health workers curricula synthesizing evidence to align CHW competencies with health system needs. Ms. Leby's dedication, expertise, and impactful contribution has made her an exemplary candidate for the Fellowship of African Institute of Public Health Professionals. Congratulations, ma. Please let's put our hands together for her. Dr. Rashidatu Kamara. She the one? Okay, she's collect. Oh, you're welcome, ma. While she's representing Dr. Rashidatu, can Dr. Ibrahim Mark Kapua please come forward? Ibrahim Mark. It's not Kapua. Please come on.
Kapua.
I know we have Kapua in Nigeria. So when I called it, they were laughing. We actually have Kapua in Nigeria, so I know I didn't. Did I call it wrongly? No, I'm not reading for her. Come. Which number? Ibrahim.
27.
Ibrahim, right? While Ibrahim is being decorated, Dr. Miriam Mustafa, please get ready. Ibrahim is a distinguished Sierra Leonean surgeon and healthcare administrator with extensive experience in surgical care, hospital management, public health, and healthcare system strengthening. His commitment to advancing healthcare in Sierra Leone is evident in his leadership of hospital operations, strategic planning, policy implementation, and service improvements. He's recognized for his excellence. Dr. Ibrahim has earned multiple awards, including Medical Practitioner of the Year. Congratulations, sir.
This guy is sick. Call him.
I should call him now.
Yeah, 32.
Can we have Dr. Thomas Bendu? Please, okay, please hold on. Let Dr. Thomas come first.
No, he's coming.
Okay,
slowly.
while he's coming, Rashida too.
Mustafa?
Okay, yeah.
Okay, let's go with Thomas.
Okay, she's here already.
Okay.
Yeah.
Okay.
Dr. Mariama Mustafa is a distinguished consultant, pediatrician, and public health leader, renowned for her expertise in health. In 15 years of transformative experience, Dr. Mustafa has played pivotal roles in shaping public health policy and implementing groundbreaking programs on both national and international stages. Currently, Dr. Mustafa serves as an international public health consultant, offering expert technical guidance to government and leading organizations such as WHO, UNICEF, UNIAIDS, the World Bank, etc. She enjoys reading, dancing, traveling. Dr. Mustafa is married and a proud mother of 2 children. Congratulations, ma. Dr. Thomas Bendu. While he's being decorated, Dr. Abdul Jallo, please get ready. I thought you said 42. 32. Dr. Thomas is a seasoned social work and counseling professional with over 2 decades of experience in public mental health and child welfare, primarily serving at-risk children, youth, and families in Washington, D.C. and Maryland regions in the United States. His continuous commitment to social work by offering consultancy services to enhance mental health and social services. Dr. Bendu's academic achievements include a Doctor of Public Health and a Master of Public Health from Walden University, a Master of Social Work from Howard University, and a Bachelor of Science from Njala University in Sierra Leone. Presently, he serves as a licensed counselor with Hopeway Mental Health, along with many other roles. His hobbies include traveling, gardening, and reading. He's married with 3 children and 2 grandchildren. Congratulations, sir. Dr. Abdul Jallo.
Page 20.
While he's coming forward, Dr. Mahmoud Idris Kamara, please get ready.
Page 20.
Dr. Abdul Jallo is a global mental health specialist and consultant psychiatrist with over a decade of experience in mental health. He specializes in mental health system strengthening, epidemiology, research method, health policy, and innovative interventions. He's a lecturer at the College of Medicine and Allied Health Sciences in Sierra Leone, and he holds an honorary clinical lectureship at the University of Glasgow. Dr. Jallo has provided consultancy services to numerous organizations. He's currently the mental health program manager at the Ministry of Health in Sierra Leone. He also serves on the board of the National Drug Enforcement Agency, leading mental health initiatives in the country. Congratulations, sir. Please, let's put our hands together for him. Dr. Mahmoud Idris.
Did I call this correctly?
Yes.
It's not Mahmoud.
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 Yes, called Dr. Osayo Kamara. Dr. Osayo Kamara. Osayo Kamara.
Can we have Dr. Osayo Kamara on stage to help decorate Dr. Mahmoud? Dr. Osayo Kamara. Dr. Mahmoud is a committed and seasoned health professional with extensive experience in both clinical and public health practices for over 20 years. He has worked in different capacities in health service delivery. He is currently a district medical officer in the Ministry of Health, first in Port Loko district and currently in Moyamba district. He has also played a massive role as an incident manager during the COVID-19 pandemic and mpox outbreak, serving as surveillance team lead and incident manager. Dr. Kamara is serving in a range of national and local agencies and organizations as a key stakeholder. He's a board member for St. John of God, Lumsa. Congratulations, sir. Dr. Donald S. Grant.
Can I help you?
Dr. Donald.
Yes, Masale, Dr. Sister Nathan Masale.
Can we have Matron Masale on stage to help in decoration? Dr. Donald, please.
What could do? I've not checked it. Grants. Hurry.
Lassa fever. He has been an investigator on a wide range of international sponsored research investigating Lassa fever. His involvement in these researches helped in developing important clinical laboratory surveillance and data collection tools that now serve as a strong platform for training of clinicians. Currently, he's a district medical officer in Kenema, Ministry of Health, responsible to providing quality health services to the people through primary health care services in 134 health centers and 2 hospitals within the district. Congratulations, sir. Dr. Mohammed Sheku. Okay.
28.
Dr. Mohammed Beshe Sheku.
Next person, call this. Man of the problem. Call him just call it.
Joseph Silvanus Bangura, please get ready.
Look for Joseph Silvanus Bangura.
Dr. Mohammed Beshe Sheku serves as the District Medical Officer for Keynote District in Sierra Leone, bringing over 15 years of dedicated experience in both clinical and public health sectors. He's committed to continuous professional development and he has acquired several certifications. He also holds a certificate in policy and management and is an alumnus of the Academy for International Business Officials in China. In his role as DMO, Dr. Sheku has been instrumental in transforming healthcare delivery in Keynote District. He has expressed should I go on?
Go on.
Okay. He has expressed gratitude for governmental support and highlighted the significant impact of healthcare initiatives on the local population. His leadership continues to drive improvement in public health outcomes, reflecting his unwavering dedication to the well-being of the communities he serves. Congratulations, sir.
It can't be in your home. This is day 2 I did.
This is what you gave us. This one is the one you gave us. You see, the one you got. You don't have it. This is what you gave us. That is just.
Dr. Joseph Silvanus Bangura, please come forward.
I gave you my program. I wrote my name on it. Day 2, please look for it.
He's a public health specialist with extensive experience and expertise spanning over, Hello.
Mike.
Spanning over 13 years in hospital management and primary health care, particularly in disease prevention and control. As a substantive DMO of Bombali District Health Management Team in the Ministry of Health, he has contributed immensely in health system strengthening, universal health coverage, reproductive, maternal, newborn and child adolescent health, health promotion and education, disease surveillance through health security and emergency. He holds a master's degree in public health and honorary masters of essentials of public health from Southern Medical University of the People's Republic of China. He has exemplary leadership management and teaching skills and has been engaged in continuous professional development of healthcare workers. Currently, he's a part-time lecturer at the University of Makeni. Congratulations, sir.
So anything, continue.
Okay. Dr. Prince Masuba. What page? Please can we have Dr. Prince Masuba? While he's coming, Dr. Amara Stevens, please get ready.
Excuse me. Okay, Hello.
He's absent. Prince is absent. Okay.
What's this? Take.
Dr. Amara Stevens, please. He's a dedicated medical epidemiologist with over a decade experience in the field of medicine and public health. He holds a Master of Philosophy in Applied Epidemiology and Disease Control, a Master in Public Health Informatics, as well as a bachelor degree in medicine and surgery. He has served in various hospitals across Sierra Leone. Dr. Amara has been instrumental in responding to the significant public health crisis, including outbreaks of cholera, measles, mpox, and Lassa fever, as well as leading efforts during the West African Ebola outbreak and the COVID-19 pandemic. Throughout his career, he has been committed to improving health system and strengthening disease prevention and response mechanism in Cameroon. Congratulations, sir. Dr. Augustine Jimisa. While Dr. Augustine is coming, Dr. Sheriff Jallo, please get ready. Dr. Augustine earned his Bachelor of Medicine and Bachelor of Surgery in the College of Medicine and Allied Health Sciences, University of Sierra Leone, and his postgraduate master's degree in International Public Health, Sexual and Reproductive Health at the Liverpool School of Tropical Medicine in the United Kingdom. He has over 20 years of working experience with the Sierra Leone Ministry of Health across all regions of the country. He has worked in both rural and urban settings in the capacity as clinician, administrator, and in the health of women and children. Congratulations, sir. Dr. Sheriff Jallo. Dr. Sheriff. He's not here.
Jallo, Sheriff Cherino, he's already on stage.
Oh, he's already on stage. Oh, which page?
21.
He has over 20 years experience in clinical and public health practice in Sierra Leone. He's passionate about his profession and enjoys saving lives of patients and improving the overall health status of communities he serves. Dr. Sheriff has a degree in general medicine. He holds a Master of Public Health degree from Njala University. Dr. Jallo is a board member of the Kanakwi West Selene Hospital and Silima Cancer Foundation Forum in Karen District. Congratulations, sir. Dr. Brema Bobson, please.
Page 18.
While he's coming, Dr. Daniel Lavallee, please get ready. Page 18, right? Dr. Brema Bobson is an esteemed medical professional with over 15 years of dedicated service in healthcare. He has significantly advanced public health in Sierra Leone. Currently, he serves as a district medical officer in Bondi District under the Ministry of Health. In academia, he has imparted knowledge as an associate lecturer in the Department of Medicine, Bo Campus, Njala University, and as a part-time lecturer at the College of Medicine, University of Sierra Leone. He has received extensive international training in global leadership, emergency management, and health system strengthening. Congratulations, Doctor. Please put your hands together for him. Dr. Daniel Lavallee. Dr. Daniel is the current district medical officer in Falaba district and has worked the length and breadth of Sierra Leone since 2013, serving in different capacity. He's a graduate from Commerce with a bachelor degree in medicine and surgery. Dr. Daniel has contributed significantly in the national response to public health emergencies, notably the 2014 Ebola outbreak, COVID-19 pandemic, and mpox outbreaks, amongst others. Congratulations, Dr. Sashiko, Matron Hosanna.
Yeah, and Matron
Margaret Mana. Okay, can we have Matron Osanatu and Ms. Mana to please come forward and help to decorate the new fellows? Dr. Sheku Alaji Koroma. Is he here? Dr. Sheku. Dr. Sheku. Please, Matron Hosanatu and Margaret, please come forward to assist in decorating the new fellows. While Dr. Sheku comes forward, Dr. Francis Lansana, please get ready. What page is that? Doctor, you can go forward. Yes. Dr. Sheku Halaji is a cataract surgeon and a public health practitioner. He has worked at the Department of Ophthalmology, University Teaching Hospital Complex since 2000 and has contributed drastically to reducing and combating blindness in Sierra Leone, both in and outside the operating theater. Dr. Sheku is presently the project manager for the Western Area Eye Care Project and also doubles as the Deputy Program Manager for the National Eye Health Program. His service to public, especially in the area of eye care, is just too inspiring for young professionals to emulate. Congratulations, Doctor. Please let's put our hands together. Dr. Francis Lansana.
Amelia Eva Gaba.
While Dr. Francis is on stage, Amelia Eva Gaba, please get ready. Okay. Dr. Francis is a seasoned public health professional and medical doctor with over a decade of experience in clinical practice, epidemiology, health education, and policy development. He has held key leadership roles, including district medical officer, where he managed over 500 and several health-related projects. His research interests encompass infectious and non-communicable diseases, maternal and child health, and health policy. Has contributed to the studies on Ebola transmission and nurse attrition in Sierra Leone. Dr. Francis is recognized for his commitment to health system strengthening and capacity building. His contributions has aimed in multiple awards, including the recognition as the best medical practitioner in the Kalahun district and the award nominee as the best health practitioner in Sierra Leone 2019. Congratulations, Doctor. Amelia.
Miss Amelia Gaba.
Amelia Gaba, please. May Sata, please get ready.
So next is this. This is what you're supposed to do.
Amelia Gaba He is a public health nurse specialist, member of several professional bodies, fellow of the College of Nursing and Midwifery, Sierra Leone. She has diligently served the nursing profession in the public health sector for 38 years. She has masters in public health from the Njala University. Mrs. Gaba has played excellent leadership roles with excellent interpersonal relationship at all levels, national and international examiner and assessor for undergraduates, masters and the fellowship programs, and helped to develop the review, nursing and midwifery curricula, several strategic documents, including policies, manuals. Congratulations, ma'am. Ms. Sata, please. Leave that one. Mrs. Mesata. While she's coming forward, Brahma Victor Kamara, please get ready. Mrs. Mesata is a senior nurse specialist. She's an exemplary leader in public health and nursing, committed to advancing health care in Sierra Leone and beyond. She has amassed over 22 years of experience in public health, with experience in promotive and preventive health care, maternal, neonatal, and child health, the integrated management of childhood illness, the implementation of cost-effective, high-impact intervention strategies for child health prevention, and the management of leprosy and tuberculosis, and the community sensitization and mobilization. She has served as the chairman of the West African Postgraduate College of Nursing and Midwifery, Sierra Leone chapter. She's also a council member of the WAPCNM and a member of the College of Nursing and Midwifery, Sierra Leone. She's a fellow of West African College of Nursing, a member of the Sierra Leone Nurses and Midwives Board, and also a member of Sierra Leone Nurses Association. Congratulations, ma'am. And we have Brahma Victor Kamara. While he's coming on stage, Dr. Aminata Koroma, please get ready.
41.
Brahma Victor Kamara is an experienced public health professional and administrator with a master's degree in public health and over 30 years experience. Dr. Aminata Koroma. Dr. Aminata Koroma. She is a distinguished public health expert with over 2 decades of extensive experience in surveillance, immunization, nursing, and midwifery. Her professional journey includes significant contributions to national and global health agendas. Dr. Koroma holds a nursing and midwifery qualification, a master's in public health. She also holds a certificate and diploma in community medicine and health. She has completed the intermediate field epidemiologist training. She's a distinguished fellow of both the West African Postgraduate College of Nursing and Midwifery and the National and the Sierra Leone Postgraduate College of Nursing and Midwifery. She's currently a part-time lecturer at the Njala University. Congratulations, ma'am. Dr. Mohamed Mark Baba Sise. Dr. Mohamed Mark, while he's coming forward, Emmanuel Edmond, please get ready. Dr. Mohamed is the current chairman of the Bombali District Council. He received his early education in Bombali before earning a distinguished undergraduate degree from University in Sierra Leone. Before assuming office as a chairman, he has served as regional coordinator for National Commission for Children, North, regional coordinator for the National HIV Secretariat, East and Northern regions, the resident technical facilitator at DEGSET. His leadership, characterized by an open-door policy, continues to drive improved service delivery and sustainable local development. Dr. Sese currently serves as the Vice President of the Local Council. He is happily married, and the marriage is blessed with 3 children. Congratulations, Emmanuel. Emmanuel Edmond Yambasu, please come forward.
Oh, thank you, sir.
While Emmanuel Edmond is making his way, Patricia Camara, please get ready. Emmanuel Edmond has been a dedicated and driven health professional. He's a public health specialist holding a master's degree in public health from Njala University, Sierra Leone. He's also a certified community health officer from Njala University and has earned a postgraduate diploma in public health, a postgraduate certificate and diploma in tropical medicine and health from the College of Medicine and Allied Health Sciences, University of Sierra Leone. Currently, he's pursuing a PhD at Tesila American University. He has gained extensive experience working with internally displaced persons, refugees, and host communities. Currently, Mr. Yambasu serves as the Senior Technical Officer for Sexual and Reproductive Health and Rights at the Ministry of Health, Sierra Leone. Congratulations, sir. Please, let's make him feel welcome. Patricia Joanna Camara. Okay. Patricia Camara is a highly experienced healthcare professional with extensive career in nursing and midwifery. After attaining her nursing qualification in 1997, she began her career as a registered nurse at the Keynote Hospital and Children's Hospital. She later earned a master's degree in public health, a Bachelor of Science in midwifery and obstetric nursing education, and a Bachelor of Science in nursing. Since 2017, she has held the esteemed position of the principal of the School of Midwifery, Bo, and a role she continues to hold till date. Please, let's put our hands together for her. It's not easy since 2017. Dr. Valerie Ibidumi Jonku. I got this one right. Dr. Valerie Ibidumi Jonku. Okay, while she's coming, Manso Mohammed Koroma, please get ready. Dr. Valerie is a distinguished obstetrician, gynecologist, and public health expert, specializing in maternal and child health with over 15 years of experience. She has worked extensively with Sierra Leone's Ministry of Health and Sanitation and international NGOs. She holds a MBCHB from the University of Sierra Leone and M.Med in Obstetric and Gynecology from Ternopil State Medical University, and MPH from the University of Central Nicaragua. She also holds a certificate in the improvement of maternal health from Japan. Her professional affiliation include being a fellow of the Sierra Leone Council of Postgraduate College of Health Sciences and an associate member of the Royal College of Obstetricians and Gynecologists. Congratulations, Dr. Valerie. To come and decorate. Okay, can we have Dr. Al-Hassan Sise and Dr. Aminata Koroma to come forward and assist in decorating the new fellows. Sister Magdalene Philip. Okay, sorry. Manso Mohammed Koroma, please. Is it the one they are decorating? He's an accomplished public health parasitologist, researcher, and educator with a diverse academic professional background. He has also engaged in health system research with the International Development and Research Center and the West African Organization on the impact of the Free Healthcare Initiative of Maternal Health for a period of 5 years. He earned his Master in Environmental Biology from Njala University, BSc with honors in zoology in Farabe University of Sierra Leone, a postgraduate diploma in quality assurance at the University of McKinney, and a certificate in research ethics, Hong Kong University. Please let's put our hands together for him. Sister Magdalene Philip Umo, what page is that? While Sister Magdalene is making her way to the stage, Dr. Joseph Kamara, please get ready. Sister Magdalene is a Catholic religious sister and a professed member of the Sisters of Notre Dame. She's a lecturer, a researcher, and the head of the Department for Public Health at the University of McKinney. Recently, she established a Center of Excellence for Maternal and Child Health Education and Research, where she serves as the director. At the Catholic Diocese of Bakani, she serves as a seasoned spiritual director to several organizations and groups. She is also a member of the Diocesan Education Commission. She's a skilled facilitator, results-oriented, and passionate about transforming public health outcomes with focus on women and children. Congratulations, sister. Please put your hands together for her. Dr. Joseph Kamara. While he's coming forward, Dr. Joseph Sam Kanu, please get ready. Dr. Joseph Kamara is a highly motivated health economist and health systems and health financing expert with a track record of successful collaboration across international and national organizations. He has participated in short courses on health at Harvard University and MIT in the US, the London School of Hygiene and Tropical Medicine in the UK. Joseph has consulted for many international and national organizations. The highlights of Dr. Kamara's career are that he provided technical and operational leadership to establish and launch the SLESHID, led the reform and the costing of primary health care in Lebanon, and assessed the universal health coverage component of the Big Five in Kenya. Congratulations, Doctor. Dr. Joseph Sam Kanu, 50. he here? He's not here. Dr. Roland.
Ronald Chassin Marsh. Cashon Marsh.
Dr. Roland Cashon Marsh.
Roland, no? It's Roland, no?
It's Ronald.
Sorry, Dr. Ronald, sorry.
What page?
Dr. Ronald, please, can we have you? Somebody is coming out. Then Dr. Abubakar S. Kamara. Dr. Ronald Mother is here. Please let's put our hands together for her.
Thank you.
Welcome.
Where's the oats? Ahmed, can we start giving them the oats? Oats. All of them. What page is
Dr. Abubakar S. Kamara. Dr. Abubakar is a distinguished academic and public health expert with extensive experience in research, teaching, and consultancy. He currently holds the position of lecturer at the Njala University, Sierra Leone, where he also serves as director of the Center for Pedagogical Excellence. His academic qualifications include a PhD in public health, Master in Public Health, and a BSc Education in Chemistry, Biology, all from Njala University. Dr. Kamara, with over 20 years of interdisciplinary expertise, specializes in health system and strengthening, environmental health, and infectious disease control. Dr. Kamara has held key academic and administrative leadership roles, including the head of Public Health Department, departmental postgraduate conductor, and served on several university committees. He's a leading expert in public health research and education in Sierra Leone, recognized for his work in health system capacity building and community health interventions. Congratulations, Dr. Abubakar. Congratulations to all the newly inducted fellows. Can we have all of you on stage as you take your oaths? Please, can you all come on stage as you take your oaths? We are done now.
What again? Please, you have to come upstairs. Everybody.
No, just drop your plaque, drop your certificate.
No, you just give them. Share it and give.
When they come in, just give them. Give me one.
No, don't follow, please. I don't have money to buy cow.
I was thinking of taking that drone shot downstairs.
I don't know. Anyhow, me, I'm already exhausted, so. Please, can we move backwards a bit so we form a curve and everybody will be in front? Let's move backward a bit so it will be a curve.
It's just that it's different. We just stand there and then recite the oath. But now look at this. Some of us, you see, we are not even being seen.
We'll form a curve. I don't follow, please.
Stood there.
On it.
On. We can't see. But you can't see. So we can move. Can we move? Can we move? Can we move?
I want you to set you. It's not about photograph. We are still going to snap. We still need, we are still having a good photograph. We are going to read after me. We are going to repeat. Can we go?
Yes, yes, yes.
After reading, we are going to write the name up after I, signature and today's date, and we are returning to us. We will return to the Director of Membership Services. Or how about, where is Albert? Albert, please take everything because this goes to your file. We have file for all of you. So can we go? Therefore, repeat after me. Therefore, as a member, hi, your name? Pledge to conduct myself professionally with truth, accuracy, fairness, and responsibility to the public. To foster the highest standard of professional competence. Among those whom I am responsible. To enhance the proficiency and the stature of the profession by acquiring and applying knowledge in the most appropriate way or manner. To participate in all professional development programs. So that once knowledge and performance are enhanced, to dissociate myself from them or bring the institute into disrepute, to honor the confidence received or given in the course of my professional activity, to comply with both letter and the intent of the law of the country in which I practice and agree contractual obligations, to cooperate with all organizations and individual engaged at all times, to respect the truth and shall not disseminate false or misleading information, to abide by and to encourage others to practice the professional code of ethics of the Institute, that I made this pledge in good faith and in accordance with the policy of the Institute. So help me God. Please listen. All of you are fellow. After your name, you are going to put FAIPH, Fellow Africans for Public Health. FAIPH. Let me see name I can remember. Okay, Margaret who? Margaret Thatcher. Magdalene Kumor. FAIPH. Fellow Africans for Public Health. And of course, the certificates you are receiving from us form part of your qualification, because our is an academic. I mean, we are not educational institute, but we are professional institute. So I was very happy yesterday when Professor Mohammed Kano discussed the essence of practical knowledge. We are still going to collaborate with the issue of health professional development for manpower development, to encourage, to enhance the health profession in this country. And again, if you are not been participating in our activity, you stand to lose your membership. We have such a case. Before I left Nigeria, somebody called me from the US and said he needed a recommendation. He needed, I asked my secretary to go through the computer. He has already deleted him because he has not been participating. So we give recommendation as professional body. Whatever you want, you are part of us. And lastly, there is annual subscription of just token. The token is $50 every year. And of course, it's still going to be paid to where you pay your registration, to the account of Institute of Health Professional Development. We intend not to make things difficult. It's just $50 every year. So please sign, date, and return. Congratulations, please. And please.
So how the Falaba?
The
No. The road is bad, yes. The road is bad. How the two work centers until they are okay?
Thank you.
That's logical thing. Oh, okay. I need to wait.
So please, let's do quick.
Thank you so much.
My regard. So there's time I'll come and see you in District 1 of the
No problem. I really don't have enough time.
Thank you, sir.
I'm coming, please.
Hey, take time. Take time, sir.
Don't go inside.
Yes, yeah, they're for candle.
Before, yeah.
Yes, I will call you. Any kind of time for no problem.
Sir. How bad, Bob? How bad?
Yes, so please, let's take our seats again. Take your seat. We've done the induction. We now need a vote of thanks.
So don't begin to apply the plan.
Take your seats, take your seats. We're wrapping up now.
Yes, you can use it.
You're here?
I must give it to me.
Come on, this one I can go down. One finish now. Hello, Ameti, what are you doing? Oh, no, no, wrap up. Do you? Huh? Hey, oh man, well, send them all. Oh, 1, 2 there now. Everything. This is one do the vote of thanks. Yes, please. No offend them. You see that? Don't see you? Don't say it. Oh, anyone?
No, but
for somebody in the...
on it.
They say pick anyone.
Then you don't remove this.
All right, colleagues. We've come to the end of day 1. I'm pretty sure we are successful here. We are really concerned around able to finish, say, around 4. So, thankfully, we managed the time. We are done. And again, congratulations to you all and your families. We are going to continue tomorrow, the second day. We have our colleagues, day 2, who are here to be part of the launching of the chapter. We thank them for sparing the time. And tomorrow is their own day, their own moment. They are going to be inducted too. And for you as the one, our senior colleagues from the various universities and of course the Ministry of Health, is an opportunity for you also to be able to decorate maybe your junior or your supervisors. So it's not mandatory, but you are highly encouraged to be here and preferably in your gowns as alumni. Please, if you can make it, fine. So, with that, colleagues, we now need to end this day by someone, the head, the leader of all the nurses of this country, to give us the vote of thanks, and that is Matron Fuller. Matron Fuller, en français, on dit, vous avez la parole.
Merci beaucoup. Good afternoon, everybody. I want to take this opportunity to thank everybody. But we start with God Almighty for bringing us here today. For the past 2 days, we have been together anyway. So we thank God for giving us the strength to be together. And I want to thank the organizers, the team of itself, Dr. Kanu and team, for organizing this all-important event for us in Sierra Leone. I want to also thank the leaders, the representative from Nigeria, He was with us yesterday, but today I think he has gone back home. I want to thank, there's another Dr. Kanu, I think who went away this morning. He was there this morning. They left their busy schedules to come and join us to ensure that we have a successful ceremony. Above all, I want to thank you all. Without you, we will have done nothing here. We need you all, and you have participated fully. We are proud, but we have a goal. Somebody asked in the presentation, what will be your role? Because it's now going to be individually and collectively. Individually, what is your role beginning today as part of this institution? Let's think about it. Let's write it down. Yesterday, somebody asked, what can we say about public health? I proudly wrote, it has to be a selfless sacrifice. To be a public health official, you have to be a selfless person. You have to be there at all times. It's the ownership. We have to own this organization, this institution, meaning we have to participate. We have to ensure that we ask for the trainings, we put in for trainings, short trainings, so that we can be part of the growth. And then the next step is taking it out to our nurses, our midwives, our doctors who are not here, who are not privileged. They can also become part of this institution. Yesterday they told us it is not just institution for just, in fact, healthcare workers. Engineers can join us. Can you remember that? He said engineers, everybody is part of it. So we will encourage other people to come on board to ensure that this works well for Sierra Leone. I want to thank, who else? Everybody. What about our family friends? Hello, without you, this hall would have been very empty. We are proud of you. We want you to be part of us on this journey. It's not an individual business. When they say public health, it's everybody's business. So you are welcome at any time. Thank you very much. I want to thank myself because this is the second time I'm giving a vote of thanks. So today I'm going to say a big thank you to Mary Fuller. Thank you very much.
Thank you very much again. Matron Mary Fuller. Double assignment, vote of thanks. Is there anyone for Dr. Ali Wuri? Ali Wuri. She left. Okay, Fodesa. For Fodesa, please collect. All right. So with that, Bawa.
It's on the way. They are not yet here. Ladies and gentlemen, we were expecting to have completed the program by 4, but unfortunately, we have finished a little earlier. The food is on the way. So let's give them another 20 minutes because of traffic. They've left. We are not anticipating to have finished earlier. But because we cut down on the citations, so we finished a little earlier. The food is on the way, and it will be here in the next 20-25 minutes maximum. Thank you.
Hello. Owner of the pool number AOR